todas y todos los panelistas que nos acompañan, a toda nuestra audiencia que nos acompaña por Zoom y por las redes sociales de la Conferencia Interamericana de Seguridad Social. A nombre del secretario general, el maestro Álvaro Velarca, les damos la más cordial bienvenida a este cuarto día de paneles sobre los diálogos de alto nivel hacia una visión global de la seguridad social. Este día estamos abordando el tema de salud
On
digital
social
en contexto
security,
de
we are
violencia global.
addressing
Un panel que
digital
fue
health, the
desarrollado por la
future of
Organización
global well-being.
Interamericana
This is a
de
panel that has
Seguridad
been
por la Asociación
developed
Andina
in
de esta
collaboration
conferencia. Me acompaña en sala
directly
el
with
Polito Vilchis, quien fue
our
integrante de la asesora de
CISS.
paneles.
We have a
Quien le
Polito
agradezco
Vilchis.
la
He
coordinación del
is
panel.
also part of this,
Pues
and
el tema
I
de
would like to
hoy
thank him for moderating this
convoca
panel.
muy
So
interesante, pues
today, the
debido a
main
la
reason why we're
concentración de
here
distinciones
today
áreas del mundo en los
is
últimos
that we're
años,
going to
los
discuss a
sistemas de
very
salud han
important
tenido que
topic.
adaptarse
This
de
is
manera
related to
acelerada
the different
a
health emergencies that
para ser
have
más eficientes
emerged
ante
over
la
the past
respuesta a estas
years.
emergencias.
And we're
En
trying
este
to
sentido,
have
hoy
these
hablaremos de cómo la
adaptations towards
tecnología
the
digital ha sido
more
clave en la
efficient
transformación del
response
sector
that we're
salud.
giving to these
El
emergencies.
enfoque
Today, we're
central
going
es
to be
definir la
addressing
inteligencia
technology,
artificial y
its
la
key
ética en la
role in
digitalización de
transforming
las
the health sectors,
multidisciplinares. El desarrollo de
focus
la
on
tecnología ha
AI
potencializado
in
múltiples sectores de
telehealth,
la
as
salud
well
como la
as the
concepción.
digitization of
A lo largo
medical
de la
care,
sesión
as well as the development
dialogaremos
of
sobre avances,
other types
desafíos y
of services.
oportunidades que
We are going to
presentan
be
estas
talking
nuevas
about the
tecnologías
challenges,
para optimizar los
opportunities
servicios
that we
médicos, mejorar el
see as
bienestar
part of these
global.
new
En
technologies to
especial
make
veremos los casos específicos
this
de dos de los países que integran la
services more
CISS,
streamlined and
República del Perú
specifically
y
for
el Estado
social well-being.
plurinacional de
So
México.
we're going to be talking
Agradecemos
about what
también la
happens
presencia
with
de nuestros
the
panelistas que
Republic
nos
of Peru
compartirán sus
and the
experiencias y
plurinational state of
conocimientos.
Bolivia. We would like
Antes de
to
empezar
thank
con las
all of our panel
intervenciones,
members
tengo
for
el honor
sharing
de
their
ceder el uso de la voz a la
experience
consejera
and their
Stephanie
knowledge. So
Cristel
before we
Díaz
start
Quirós,
with their
jefa de la Oficina
participation,
de
let's pass the
Cooperación
floor to
Internacional y
Mrs.
coordinadora de
Mistel
la Asociación
Quiros.
UNO.
She's a head
El
of the
representante de
International
esta institución ante el
Cooperation
Comité
and the
Permanente de la
Subregion
Conferencia nos
1
dará unas palabras de
manager. She's
aliento.
also
Doctora,
representative
le
of this
dejamos con las palabras.
CISS
Nos pedimos.
Permanent Commission. So I'll like to pass the floor to you,
Muchas
Mrs.
gracias.
Diaz.
Buenos días
Thank
a
you.
todos, estimados y distinguidos
Thank you,
panelistas,
everyone.
participantes,
Thank you, dear
colegas
panel
de toda la
members,
región. Es para mí
participants
un
from
honor
all of the
inaugurar
region.
este panel
It's
en
such an
nombre del
honor for
Seguro
me to
Social de Salud de
open
Perú,
this panel on
SSADU.
behalf of the Social
Asimismo,
Security
extender un profundo
institution
saludo
of
muy
Peru.
especial al
I would also like
secretario
to greet
general de la Conferencia
especially the
Interamericana
Secretary
de
General
la
of the
Seguridad Social, al
CISS,
doctor Álvaro
Mr.
Velarca, y
Alvaro
a todos los
Velarca,
presentes.
and
Es
all
un
of the
honor para mí hacerles llegar
participants who are
este
attending
saludo
today. It's such an honor
institucional
for me to greet you
de la
all on
presidenta
behalf of
ejecutiva
the
del Seguro
institution, on
Social,
behalf
la
of the
doctora María Elena
executive
Aguilar del
President
Águila,
Mrs.
y a la
Maria
vez
Elena
de quien les
Aguilar
habla.
del Águila, and also
Mi
at the
nombre es
same
Stephanie
time
Cristel Díaz
on my own
Quirós,
behalf.
jefa
My
de la
name is
Oficina
Stephanie
de
Cristel
Cooperación
Diaz Quiros. I
Internacional
am
del
head
Seguro
of
Social de
the
Salud
International
y
Cooperation
coordinadora de la
on Social
Subregión
Security
Andina.
Bureau, and
Darles
I'm
la
also
bienvenida a este
a
cuarto panel marcado
manager specifically for the Andean region.
en la tercera edición de Diálogos de Alto
This is the
Nivel
third
hacia una
edition
visión
of the
global de la
high-level
seguridad
discussions
social,
towards a global
titulado Salud
vision of
Digital,
social
el futuro del
security. It is
bienestar global.
entitled Digital Health,
Panel
the
que ha sido
future of
desarrollado y
global
creado en
well-being. This is a
coordinación con
panel
la
that has been
subregión andina.
developed
Me
along
complace
with this
reconocer el esfuerzo
Andean
que todas
region.
las
I am really
instituciones miembros
pleased
de la
to be
Conferencia
part of this
Interamericana de
effort that
Seguridad
all
Social han
members
realizado a
of the
través de la conferencia,
CISS have
el
taken through
órgano
their own
encargado
regions.
de
This
abordar las
is the
prioridades de
body
los
that is
países que
responsible
conforman
for
nuestra membresía.
just really
Estos
addressing the priorities
diálogos,
of the
que
countries
ya
that
han
are part
alcanzado su
of our
tercera
members.
edición,
These
son pruebas de
discussions that
crecimiento y
are now the
consolidación
third
de
edition
este gran
are
esfuerzo
the
colectivo, el
evidence,
cual se ha
living
convertido en un
evidence that
espacio
we are
fundamental
growing
para
and
el intercambio
really
de ideas
establishing this
en
great
la región.
effort for us to be able
El
to
creciente
exchange
desarrollo
the different
tecnológico
ideas across
ha
the region.
reconfigurado
This
diversos sectores de la
technological
sociedad y
development
la salud no ha sido la
has
excepción.
reconfigured
En
the
los
different
últimos
sectors of
años hemos
our
conocido
society,
el
and health
surgimiento
has
de
not been
herramientas
the exception. Over
innovadoras
the past
como
years, we
la
have been
inteligencia artificial
witnesses on
aplicada al
how
diagnóstico
innovative
clínico,
tools
el
have
monitoreo
emerged
remoto de pacientes
by
mediante
applying
dispositivos digitales.
AI. We have used digital
Todas
devices in
estas
doing so.
innovaciones han
And all
abierto
of
nuevas
these
posibilidades para
innovations have
mejorar la
opened new
accesibilidad y calidad de
possibilities
los
to improve
servicios
our
de salud
accessibility
y
and
han sido
quality
impulsado
of
una
our health
evolución sin
care
precedentes de
services.
una manera en
And
que
it has also
percibimos y
fostered
gestionamos el
an
bienestar de
unprecedented
todas las
evaluation in
personas.
such a way
En
that
América
we
Latina
can
ha
also
tenido un gran
really
interés
ensure
en
the well-being
desarrollar
of all people. In
proyectos
Latin
que
America,
hagan
we have
más
had this
eficientes los
huge
sistemas de
interest
salud,
in
como
developing
la
projects that can
telemedicina
make
o la
more
implementación de la inteligencia
healthcare
artificial
system
en el sector de
more
salud.
efficient, such
Sin
as
embargo,
telehealth
al
or
ser
the
una
implementation of
revolución tecnológica,
AI
también
in the
enfrentamos
health
importantes
sector. However,
desafíos. La
facing this
adopción
technological
acelerada de
revolution,
estas
we also have
tecnologías,
challenges such
particularmente a
as
raíz de la
the
pandemia del
accelerated adoption of all of these technologies, specifically after the COVID pandemic. And this has also just made more evident that we just needed to really strengthen some areas and also to make sure that we have tools accessible to all persons, regardless of their location or socioeconomic condition. The protection of our patient privacy is also really important when it comes to digitizing data. We're also working under health so that we can just have a proper adoption of these technologies and deploying them. So, as part of this panel participation, I just wanted to congratulate you all. Thank you for taking part in addressing what is digital technology doing, specifically when it comes to AI to transform our healthcare systems. Throughout this day, we will delve into how telehealth can improve equality when it comes to accessing healthcare services, such as the algorithms used to analyze data and to provide customized care. And how can we really face these legal, ethical challenges that can help us providing better care? Now, the path is to have the full adoption of these technologies that requires a cross-disciplinary approach, including not only healthcare professionals, but also technologists, experts, and those persons who are served by us and provided care, which are our patients, so that we can have also a specific term for us to be able to improve the life and the quality of life of our people. So we need to make sure that we do this ethically by respecting the privacy of medical care data and that all healthcare professionals that are involved have all of the required skills to have a proper deployment. I just wanted to thank everyone for taking part in today's session. This is a meeting where we are going to have the chance of exchanging ideas to learn from others' experiences and working together when it comes to creating solutions that can allow having a more equitable and healthy future. I would like to urge you to have an active participation in the discussions that we're going to have. You can share your perspectives by doing so. And without further ado, I just wanted to just welcome everyone to this event. Thank you. Thank you, Mrs. Stephanie. Thank you so much for your commitment to the sub-regions. We know that this is a key position that we have as the VP and sub-regional manager. So without these positions, it would not be possible to have the active planning of all of these sessions. So I would like to introduce our first panel member. We're going to have four of them. All of them are specifically specializing and they have a career in digital healthcare. So I would like to introduce Mr. Jordi Serrano Pons. He is a physician specializing in family medicine. He is an entrepreneur in the digital healthcare arena for over a decade of experience. He has headed innovative projects that are having an impact on global health. He is the founder of a company that is called Universal Doctor. It is a pathfinder company in the creation of digital tools to improve multilingual medical communication. He also was awarded the 2015 Global Champions Award by the UN in the digital health care category as well. We know that Jordi co-founded Epidemics, and this company is focusing on interventions and studies related to the social determinants of health, planetary health. And we know that as part of his efforts, he has actively collaborated with governments and organizations. Jordi is also a member of the expert committee of the UNICEF in Spain. He has been recognized as one of the leader in terms of healthcare technology in Europe. He was selected by the Future 50 IMS Europe in 2018, which is an effort sponsored by the IBM Watson Health Fund. He's also an ambassador of Barcelona Health Hub and Mobile World in Barcelona. And well, he just practices digital healthcare development internationally. Thank you so much for introducing me, for having me, and for allowing me to give this important presentation to talk about universal healthcare coverage. I would like to share my own presentation from my own computer. So please just give me a second. I have many windows open, so.
¿Veis la presentación?
So can you see my presentation now? Yes.
Perfecto. Pues
Great.
nada, un placer muy grande.
All right. So it's such an honor to be here sharing this day with you. To be honest, I really intend to focus this topic towards universal digital healthcare. This is for us to be able to address the different needs that we have in the coming years, specifically after a pandemic. We know that there's no clearer and more immediate way for us to be able to progress in terms of the digitization of the sector when it comes to really putting these innovations and needs together by bringing them together to provide universal healthcare beyond just really providing the well-being of ecosystems and people. Accordingly, if we were to think about, well, the Star Trek movies, for instance, I don't know if you recall this, they would land in a planet. So if we were to be looking at the status or the condition of our own healthcare uh, systems, not only the planet, specifically, let's say in the Americas, here we know that we put the Americas at the center. What would be the QR of the healthcare systems or the overall totality of them? We could just really get to a summary of that condition or of that status. So each point that is making up that QR code is going to be contributing, and it is going to be giving us a picture of how this universal healthcare system is doing, the demand of patients, and how all of this is important, and also providing really support to healthcare providers by assisting them with technology. But if we are not really adding all of this up, we could not get to a positive outcome. Now, for us to start just really talking about the planet in the past, well, we know that certain hospitals, for them to learn what was the antimicrobian resistance for the coming months, they would run some analytics or uh, many years ago. Well, they were just making these calculations to learn what was the antibiotic resistance. And now we're just testing seagulls and birds to do all of this. They're just really being bacteria resistant, and they can just do this type of analysis pretty quickly. So we are more globalized, and whatever happens with them, it's going to happen to all of us. So I'm a family doctor, I'm an entrepreneur. I've been lucky to work with the different governments, with different organizations. So I have kind of a let's say two sides of the story. I can have different standpoints, whether as a medical doctor or as an entrepreneur. So I can talk about how we have been working in the different global health care provision. So we were launching in 2008 an app that was called Universal Doctor. It allowed us to work with many governments, and we found that we ended up working in 2012 in Geneva with the WHO, and then we had Ebola and Zika and global pandemics that allowed us to just work globally. We do not know how we just went from just having a single product, and then how we started just providing these services to different government agencies. Just we started to have just healthcare, as let's say mental health care for aging processes, and we had a huge team behind us. We started working in over 38 countries. Our whole team of over 25 persons. We were present in different countries. We were having mental health care, again, aging, global health, palliative care as well, infectious diseases, and all types of diseases in Latin America. So we will just keep on just really explaining all of this. We have been really trying to see both sides of the story. So right now we are deploying interventions that are related to preventive care. That is no better way for us to keep on moving forward. But to do it with prevention, sometimes there are no resources, or or persons do not want to be treated because they are suffering from chronic diseases that are incurable. So if we get into the core of this, then we can tell that healthcare is based on value, meaning value-based care. All of this is very important for us to understand that in many sites, if we're talking about 194 countries in the world, and we're focusing on the OECD countries or Latin American countries. And if we think about their social security systems in many locations, we know that this universal coverage would be just provided based on social security systems that are paid by the employer. So the implementation and the distribution of payments to the different healthcare vendors based on their activities is something that is going to be done based on processes, on, let's say, number of transactions or surgeries or visits or just name it. It's just that we know that in some points this in time this could have been just beneficial. We just need to think of, let's say, cases of burnout or not having a good quality, and all of this is going to have an impact on our future. So all of these initiatives that are implemented worldwide are trying to just really implement the systems based on results. We're not just going to pay for for some just let's say limbs that may be just amputated, or we will just try to reach the population and to help someone with a diabetic foot. So we have DTOs, or what we call as um, endpoints or evaluation criteria. We as family doctors, let's say you have glycosylated hemoglobin in the appropriate level, then you're gonna just start looking for results based on that. So this would be very interesting because it would just really strengthen the medical care system effectively. We would have the family doctor at the center or the community equipment. All of this would be done based on the social security system. So we understand that in many locations there are very few resources, and education when it comes to healthcare provision is really important because we know that this demand needs to be controlled. That means that the population, well, it would be interesting that the population could really understand how to have this minimum screening, let's say, criteria. Let's say we're thinking about, let's say, a GI disease after 4 days, then that's when we start just really considering that we may be sick or something. So it's preferable to have this long healthcare visits instead of short ones based on acute systems, right? So we are right now in a time where, well, this is a magazine from last week. Well, 2 weeks, my apologies. In New York, I was flying to Sao Paulo and I was going to the Tropical Medicine Congress in Sao Paulo. And at the kiosk of the airport, we saw these two magazines. They were cutting edge globally, in the US at least. Whenever we talk about AI, well, they were both on the front cover. This is a prevalent topic. So right now we are living in a time where we are just seeing this transformation, this breakthrough. It's not the typical blockchain of the year or passive word. No, this is a word that is now really having implications of changes of an era. So if we think about these neglected diseases, then we can tell that the distribution of these diseases is specifically in some of the low-income countries, and they're spread there, and we see that they are neglected. Why? Because we did not want to mention neglected persons. That's why we're calling them neglected diseases. So it is important to understand that AI or technology won't be of any use if we do not have political decisions that can help us decrease inequality to the maximum extent. We may not have an appropriate policy underlying this topic. So we're going to have very basic healthcare determinants, and we need to think of a framework scale for us to be able to put this AI and technology in place based on all of this. And then we have this table. I love this table. It is an equality table specifically on health topics. It is again a chemical element table. Instead of having those elements, we have equality, some equality parameters, and it is very important to consider them all. This is a graph from a weekend we spent family doctors and cardiologists together in Well, in the
un poco
US,
el
it's
encanto
kind of
y las
old. It's
palabras
from
las
five
vas
years
mejor
ago,
entre
but
unos y
we
otros.
have
Lo
again these
importante no es
basic
el
words. So
número
what's
de
important
nuevas
is not the
tecnologías o
number of new
conceptos, sino como
technologies or
veis cómo se
concepts,
relacionan
but how
exponencialmente.
they
Yo
are
puedo estar en
exponentially
medio de la selva de
cross-related. So
Colombia
I could be,
con una
I don't
aplicación
know,
móvil
in the
y
middle
haciendo
of
un test de
the
visa con
forest
un
or
teléfono móvil porque
the
hay un
rainforest in
módulo
Colombia,
extraíble y
and
se ha
maybe I
implantado
have my
una
phone
tecnología
number.
lisa
There's an,
o una
I don't know, some sort
tecnología
of
microRNA,
module
o sé
where
que
we
los
have this ELISA
estudiantes de
technology or an
tecnología en segunda línea
microRNA
natural language
technology, or I know
processing
the technology
o
students that
algoritmos
are
de
using natural
inteligencia artificial,
language
nunca hubieran pensado
processing
que
or
esos
other
algoritmos
AI
se
algorithms.
utilizarían
They may have
para la
never thought
timina,
that
la
these
guanina,
algorithms would be
¿no?
used
Para las letras de
for
la vida,
determining
para
one and
lo que es
for
la
the letters
genética,
of
¿no?
life,
Pues todo eso está tan
meaning
relacionado
genetics.
que el boom este es
So
importante.
all
Si
of
a esto
this
le
is
añadimos la
cross-related in
exponencialidad
such a way
a
that this is
la
what it
salud
makes it so
planetaria,
important. So
la
again, this is the
afectación según diferentes
exponentiality of
estudios de la
our
salud,
health,
de la contaminación,
our
de los
planetary
cambios,
health.
de la
And this
nutrición,
is how we would
de las
just really
formas de
start seeing
vida.
how the different
Como veis, las
changes in
capas
nutrition
se
and
van
ways of life
sobreponiendo
just
y
start
la
just
multiplicidad
overlapping as
de los
layers.
elementos
We
es
see this
infinita, ¿no?
multiplicity of these
No lo digo
elements,
yo, lo
and if
dice el
you can
Lancet.
tell, this
Ya
is an
sabemos que
infinite
según
number.
la
I'm not saying this,
contaminación, la
but the
humedad,
Lancet is saying
etcétera,
this, that
va a haber sistemas. Por eso podemos tener
pollution,
sistemas de
humidity, and
avisos.
all of that is
Según
going to
tu
have an
vida,
effect. We
tus
could have other types of
interacciones,
warning systems. So
tu
depending on your
sueño,
life,
cómo
on your
duermes, si
interactions,
llegas a
on how
final de
you
mes o no, si
sleep,
activas el
and if
sistema de
whether
inflamación,
you have
todo
good
esto
energy
está
by
en
the
el
end of the
cerebro.
month or
Y
not,
los
or
determinantes
if you
sociales de la
have
salud
certain
están ahí.
levels of inflammation,
Ya hay
all
mucha
of that
gente
is
que
going to
muere,
be determined by your health as
digamos,
well. We have a
perdonad,
lot
estoy
of
un poco
people
cansado.
dying
Hay mucha gente que
nowadays
muere por contaminación más que el tabaco incluso.
because of
Importantísimo,
pollution, even
patólogos,
more
capacidad
because
de
of
diagnóstica en
tobacco.
muchos
So, what
países.
happens with
Es
pathologists?
importantísimo
They
entender
have this
que muchos
diagnosis
países no
capacity
tienen
in
la
many
capacidad
countries.
diagnóstica.
Many
Incluso el
countries do
mapa
not have this
se ha
uh,
incrementado en los Estados
diagnostic
Unidos, por ejemplo,
capacity.
en el centro
So,
del
in the
país
US,
no
for
tienen capacidad
instance, in the
diagnóstica,
central
no hay
part
patólogos.
of the
En
country, they do
Australia lo
not have
mismo.
that many
En Francia hay
pathologists.
muy
Same
poco,
thing
como
for
veis. O
Australia,
sea, el
France,
sistema
not so
mundial
much. So,
necesita
again, the world
distribución de
system
las
requires
capacidades y la inteligencia
some sort
artificial y
of a
sistemas
proper
automáticos lo van a
distribution of
permitir.
the skills,
No
capacities,
vamos
and
a
these AI
permitir, no
systems
se puede
will
permitir
allow us to do
que en
that. We
algunos
cannot
sitios no se pueda ni
allow this,
diagnosticar.
or
Y
we
esto la
cannot
tecnología
allow this to happen,
lo va a
because
permitir. En ese sentido,
by
inteligencia
doing and by
artificial
using
en
this
enfermedades
technology, we could just
negligidas,
really help with
como
that.
os
So
dije,
whenever
la
we
semana
talk about
pasada estuve
neglected diseases,
en
like we
Sao
mentioned
Paulo
last week, I
explicando
was
un
in Sao
proyecto con la
Paulo
OMS, con la Organización
and
Mundial
I
de la
was
Salud,
just discussing a
de
project with
inteligencia
the
artificial para
WHO
distinguir
and the use of AI
leishmaniasis,
to make
lepra,
a
enfermedades como Bruri,
differentiation of,
lo que son
let's
las
say,
skin and police
malaria,
diseases. Y ya
the
se está
Chagas
utilizando
disease,
para
and all of
muchas
this that you see
enfermedades
on the
la
screen,
inteligencia
for
artificial,
us to
sobre
be
todo en
able to just
enfermedades
address
que
many
en un principio
diseases.
no son
Specifically,
las de
at first,
high
whenever
income
we are
countries de
addressing
momento.
these diseases, these are not the high
Aquí en este
income
proyecto que
countries
hicimos
diseases,
sobre la
and
inteligencia artificial en las
we're also
enfermedades
talking
de la
about
piel,
AI and
voy
skin
muy rápido porque
diseases.
tengo poco
So in
tiempo,
this
pero
case, I know that
lo
I'm
importante es
speaking
cómo
very
fue
fast, but
incrementándose el
I don't have
proyecto,
enough
cómo
time. So
en
again,
poblaciones que en principio
in
pues,
populations
son poblaciones
that
pues
are
con enfermedades
populations with
derivadas, ¿no?
diseases,
de poca higiene o de contactos con
let's
sitios,
say, that are caused
una
because
población,
of
pues
a
digamos,
poor
de contacto
hygiene, or
con la
because
naturaleza
maybe
explotada de
people are in
forma,
contact
bueno,
with
pues como sabéis,
nature in
ha habido
general.
en muchos sitios del planeta un aumento del
And as
dengue.
we have seen in
Tenemos
many areas of the
cantidad importante
planet,
de
there
chagas
has
en
been an
Europa porque hay
increase
mucha
of uh,
migración que no ha sido,
dengue
no se ha hecho el screening. Y todo esto es
infections, and
importante poderlo
all of
distinguir
this is
y
part of what we need to
básicamente
differentiate and
lo
identify.
más
So
importante
what's more
de
important
este proyecto
here
no fue la
of this
tecnología, que lo
project was
es,
not
sino la
technology itself,
colaboración. En todos los
but
sitios
the
que hemos recabado
collaboration in all locations
información,
where we have collected
aplicaciones,
information, where we
fotografías,
have had
etcétera.
these
Es lo más
applications,
importante. Cuando tienes un grupo de
pictures,
gente
all of this
joven
is really
utilizando
important. Whenever you have a
ChatGPT,
group
lo más
of young
importante
people
es
using
que compartan la
ChatGPT, the
manera de
most
trabajar,
important
que
is for
compartan
them
sus
to share the
scripts,
way
sus
to just really
soluciones
share the
y
scripts,
cómo
their
van
just
avanzando unos y otros. Y
hopes
si
and
no hay
dreams, and just
colaboración,
starting to
no
do
hay
all of
nada que
this. If
hacer.
there's no
Y en ese
collaboration, there's
sentido,
nothing
hay enfermedades
else
las
for
que
us to
tenemos
do. So
miles
in
de
this
fotografías
regard,
y
we have
enfermedades que
some
tenemos
other,
50.
let's say,
Como comprenderéis,
diseases.
hay muy
We
poco que
have,
hacer con eso.
as you may see, we do not
Lo
have
que
a
se
lot of
llaman
things to do.
oportunidades
So we also have some opportunities to have systematic integration whenever you're
para una
using
enfermedad,
AI,
úsela para
let's
otra.
say for a
Con
given
más,
disease, you can use
evidentemente,
it for
con
not
más
just one
fotografías
thing,
de la
but
otra enfermedad,
many
pero
things. So
no es
evidently, we're going to have
precisamente
more
eso.
pictures
Entonces,
of
ese
a different
contexto
disease. You do
y
not have
la
to
salud
put any
digital, la salud
research to waste.
planetaria,
So
la
in
inteligencia
this context, we
artificial,
know that
lo que vemos
digital
es
health
destacar es las oportunidades de
and
integración
specifically for the
sistemática,
whole world, for the planet,
tanto
and
a nivel
AI
social como
is going
tecnológico.
to take us to
En
the
ese
systematic
sentido,
integration
muchos
opportunities at a
proyectos deben
social and
colaborar con otros
technological
y, por ejemplo,
extent.
en,
We
una,
do see
en
a lot of
Barcelona,
projects that
en
need to
Europa,
collaborate
cuando
with
hubo las
others. For instance,
elecciones
in
en
Barcelona,
Bolivia,
in
se
Europe, when
reunieron
we had
todas
the
las
elections
autoridades
in
sanitarias
Bolivia,
para hacer screen
there was a
de
meeting
la
of all
población
healthcare authorities
boliviana
for
en la
them to
enfermedad de
screen
Chagas. Eso fue
the
muy bueno,
Bolivian
muy positivo,
population
porque
for the
pudimos
Chagas disease.
hacer un screening de
This
toda la
was
población
very
en ese
positive because
sentido
we
y
managed to
muy
screen the whole
agradecidos
population in that
y ha habido
regard.
una
We were
colaboración
really
total entre
thankful
ambos
for doing this,
continentes.
and
Muy
we had
rápidamente,
a
la
full cooperation
telemedicina, los
across these two
hospitales
continents,
verdes,
and
la
now
predicción,
telemedicine,
modelos
green
adaptados. Lo he
hospitals,
mostrado en la
predictive
salud
and
del planeta,
analytics,
porque ya vamos
climate
más allá
adapted,
del humano propio,
and
pero la
the
telemedicina ha
planet
demostrado
health
reducción
in general
de,
goes beyond
lo
the
que es
human. But again,
la emisión de
telemedicine has
CO2,
proven that there's
capacidad de estar más
a
próximo al
decrease on the
paciente,
CO2
a la
emissions, the
vez
capacity of
evitar,
just being closer
vamos, pues,
to
impactos
patients. And
medioambientales,
again, we need to just
la
somehow prevent
predicción, por ejemplo, en Europa hay sistemas
environmental
ahora de predicción
impact
de
and also
mortalidad
prediction, let's
en
say in
gente
Europe, to
mayor
predict
que están teniendo
mortality
enfermedades. Esto lo ha
in
hecho
the
desarrollado
elderly
IDES Global.
specifically. We
Cuando
know
los
that all of
gobiernos
this has been developed. It
hagan
is
uso de
a
eso,
global
pues
matter,
podrán
and whenever governments start
adelantarse,
using this,
¿no?
then
A
they
la
can
gente
just
mayor
start
que
just
muere en
looking
casas
ahead
de forma
and just
solitaria.
help those persons who
Unidades
are
especializadas donde se
elders
hace
and who are
énfasis
dying
de
alone
la
at
forma de
home.
cambiar los hospitales,
And
de
well,
cómo
we
la
have
primaria
these
y los hospitales
specialized
deben ir
units.
a
We're
mano.
really
En
trying to
50 años los hospitales serán
highlight
solo
how we want
para
to change
operar y
this
poca cosa
healthcare
más. No puede haber
provision
más
there.
que eso los
So
hospitales.
because we know
Y
that, well, in 50 years,
cambio,
maybe
hospitales
hospitals will only be
que
used
crean su
for
propia
surgery.
comida,
So again,
disruptores
hospitals are
endocrinos.
just
Y esto
preparing
lo
their
que
own
fomenta
food. They
es
have
esas nuevas
this
unidades de
endocrine
innovación.
disruptors. So all of that
Recientemente
is
datos,
somehow fostered by
por ejemplo, el
these
Hospital San Juan de
innovation
Barcelona
units using
utiliza
data
estos
in
datos para
the
crear
San Juan
cortes
Hospital
que se
in
llama
Barcelona. It is using
una
many data
capacidad
to create
de
what we
dimensionarlo todo, de
call
monitorizar a sus
a
niños en
capacity of
casa,
just
desde
sizing
casa en
everything
el
to
hospital.
monitoring
Datos
children,
de los
let's
satélites
say
globales que se
at
pueden
home from the
utilizar
hospital.
y hay que
We
utilizarlos
can
para
use data from
avanzar.
global
El satélite
satellites. We could
Copérnicus
use
en
them
Europa permite
to
tener datos
just
de
keep on
una
just
milla,
moving
un
forward.
kilómetro
Let's
por
say the
kilómetro de
Copernicus
toda Europa
satellite in Europe
sobre
allows having a
contaminación,
mile
etcétera,
of
etcétera.
information, a little bit more than a
Rápidamente,
kilometer
la
wide
genómica ha
on pollution
explotado
in
y
Europe.
hay
So now let's talk
capacidades
about
secuenciar
genomics.
muy
This
rápidamente
is a topic that
con
has
sequencias muy
just really
pequeños y muy
boomed.
baratos.
We
O
know that we
una
have
cosa,
very
los determinantes sociales de la
economic
salud, se sabe que
sequencing devices. So
hay
again, we know that
barrios
social
donde la gente
determinants of
tiene un nivel
health
de vida inferior,
are
la
related to,
contaminación,
let's
pero es que
say,
ahora se
some,
puede medir
let's call
en
neighborhoods
digital
where
exposure,
we see low
se puede
income
medir
families. So now
cómo
we can
afecta
just
la
really
piel
start just
diferentes
metering
sensores,
how we have the
parámetros
different
medioambientales y
sensors
cómo en
and
un barrio
how the
más
different
contaminado
environmental
ya hay,
factors are
digamos,
going to have
unos
a higher or
sensores
lower impact. And in
fisiológicos
some
que
polluted
manifiestan
neighbors, we're going to
unos
have
cambios
this type
fisiológicos
of uh,
importantes y eso se puede
physiological
saber, ya no
sensors
es
that are
teoría,
going
es
to
práctica.
identify or
En el momento
detect whether
sabemos que
there
vamos a
have
tener
been
un
some
barrio
changes or not. This is
menos
no longer
favorecido,
theory, but
se le impacta
practice. So
la
if
salud
we're
de eso.
talking about a least
Muy rápidamente,
favored
pero lo que os decía, los
neighborhood, and we
datos,
can talk about
aprovecharlos.
how
Hemos
all of
creado
this is being
una non-profit
impacted
que
on.
se
So
llama
now
Planet Health,
again, data may
que
be
hemos lanzado en
really
Barcelona, Madrid,
used
Sao Paulo, yo me
and
acuerdo muy contento,
harnessed
donde mucha gente
in,
hablaba
well, there's
sobre el tema de
a
salud planetaria,
well
comer bien,
publication, Planet
desayunar
Health in
bien y sobre
Barcelona,
todo
Madrid, Sao Paulo.
interdisciplinario.
We were
Médicos,
discussing this
sanitarios,
interdisciplinary
arquitectos,
topic
bioinformáticos,
with our,
todo el
just we
mundo
were
debe
had
estar allí. No puede haber
physicians,
congresos
architects,
solo de médicos, solo de enfermeras, solo
bioinformaticians,
de...
all of
No,
these
no,
persons were
todo el mundo.
discussing
Y
this
ahí se
same
habló
topic.
de
Everyone
responsabilidad
was
social
talking
también, porque todos los
and
sistemas
about
pueden
this
ser
and social
sostenibles.
security and how can
Uno de los temas
systems can
fundamentales es
also
la
be
antibiótico-resistencia,
sustainable. So
que es un
again,
tema donde
one
la
of the main
innovación va a ayudar
topics is
muchísimo
this
y donde
resistance to
se puede
antibiotics. This
elegir
is
como
going to be
tema
quite
para
innovative, and we
preservar
could
la
just
cobertura
choose it
universal
as a topic for us to be
para
able
todos
to
los
preserve
ciudadanos, ¿no?
universal coverage
Innovaciones,
for all
etcétera, etcétera,
citizens,
importantes, ¿no?
innovations, and many more things.
He creado una nueva
So
empresa, 30 segundos
I
de
have
publicidad, pero es una
also
empresa que
established
tiene que ver
a
con esto.
company, just a 30-second
MPH,
ad that is
la
related to
Super de
this
la medicina,
MPH Health. Again, we have customized predictive, preventive, participative, proportional primary medicine with people at the center. We have created some private clinics. They can provide care
sesiones
to
de 2 horas donde
everyone.
se
We
educa a
have
la
2-hour
población con
sessions
nuevas
for
tecnologías,
us
¿no?
to be able to
Y se les
educate
permite
the
utilizar la
population by
tecnología para
using new
hacer una consulta de
technologies. So we do
prevención.
use
Durante 1 o 2 horas
technology
se les explica
for
la
prevention. Let's say for 1 or 2
virus
hours, we would
cardiovasculares,
give them an
etcétera, etcétera,
explanation
y se
of
van de la
everything that is
consulta,
related to
depende de la
their
consulta, con
cardiovascular health.
aplicaciones,
And
con
we just
seguimiento
start talking
diario
about
de lo que tienen que
apps,
hacer
apps
para
that
mejorar
have
su salud, ¿no?
daily
Prevención, prevención.
follow-up of our
Esto,
patients. So
grupos,
again, it's prevention.
etcétera, etcétera, para mejorar la
And well,
salud,
we
que es
do all of this in
importantísimo.
a group for
Ir
us to be able to
4
improve
amigos a la
health. So it
consulta,
is really
4
important
directivos a la
for,
consulta,
I don't know, 4 friends or
importantísimo. Los
4
médicos,
directors could go
los
to the
pacientes en el
doctor's
centro
visit.
y
And
el
then
médico de
again,
familia.
we know
Lo
that
que
we have
estamos
family
viendo aquí
doctors with
privadamente, ya lo
patients
dicen los
as their
gobiernos,
main
que lo
focus.
tienen
So
que hacer
again,
los médicos de
we know
familia.
that not
Sistemas de
only
prevención,
the private
visitas
sector
de
we
1
need to
hora,
do this, but also
médico,
with governments. Again,
utilizando las
one
nuevas
hour
tecnologías
uh,
competentes
visit to the
culturalmente,
doctor.
implementando
We
cambios
can
de modelo
use these new
importantes.
technologies.
Esto
We
no
can
puede
just
ser.
really
En América, el médico de
deploy
familia es el que
changes of
cobra,
these
es
models.
una
At
barbaridad,
least
cobra todo el mundo,
in the
pero no puede
Americas,
ser.
a family
La
doctor
cobertura
is
sanitaria universal
just
debe
really,
exigir que los médicos de familia
really
sean los
expensive
que más
because
cobren. Y más que
we know
nada,
that this is not
incluso
really
el Papa
enabling
Francisco
this universal healthcare
en
again.
su
We
una
know
de
that
sus
even Pope Francis
digamos, encíclicas primeras, Laudatem Si, hablaba del
in
planeta y del
different
médico de familia a la
uh,
vez, ¿no? El
sessions that
otro
he
día, la
had,
semana
he was
pasada,
talking about the
se
planet and
lanzó
the
el primer
family doctor.
centro de salud
And
planetaria
last
en la
week,
frontera en Ecuador y
we
Perú,
launched the first
por un
planetary
colega mío
healthcare center
que
in
el doctor
Peru, in
hay que
Ecuador.
certificarlo,
It was launched by
y
one of
es
my
eso, ¿no?
colleagues.
Digamos,
So I just
cómo los
wanted to
sistemas
congratulate him and
locales,
recognize what he has been doing.
pueden
So
ser
again, we're doing all
resilientes
of this in
y
local
ayudar a
systems
los
and how
demás,
these
¿no?
local systems could be really
Latinoamérica
resilient.
tiene una capacidad
So in
brutal de
Latin
enseñar a
America,
todo
we
el mundo.
have a
Las
huge
ciudades
capacity
verdes
for
que
us to
estáis
be able
desarrollando
to
son
teach
espectaculares
everyone
y
about the
allí
green
el
cities that
sistema
are
de
being
cobertura
developed. They
universal
are
empieza
spectacular.
por un
And that's where
mantenimiento
we start with
de
that
la
universal
educación
coverage. And it starts just by
en
really
salud a la
keeping
ciudadanía
this
y apostar por
healthcare
temas
education, but not only
tecnológicos para
healthcare, but also
democratizar y que todo llegue a todo el
environmental.
mundo,
Also, we need to
pero
really start
sin un
using all of these
cambio
technological
de
systems to
pago
democratize.
por output, por resultado, será
But
muy
really,
difícil
if we
con
do
los
not get any
países
sort of
actuales los grupos
an
de
output
renacer
as
se
an
puedan
exchange,
expandir.
we
Y finalmente
would
veo
not
la
be
figura del
able
médico
to
de
do all
familia
of
como
this
el
for us to be able to
ecualizador
achieve this
para que la
universal
innovación no
healthcare.
aumente la
So
inequidad, si
again,
no
the
será
family doctor
imposible
is really
y
important as an
que la
equalizer
inequidad no
to
vaya aumentando
really
gracias a
use
la
this
tecnología
innovation
sin
to
querer.
prevent
Y a que
inequality
la
from
gente que tenga más
increasing.
dinero pueda
Otherwise, it
estar
would be
totalmente
impossible
pues con
to
una
just start
cobertura total y la gente que
pushing
no
this back.
tenga
So
ni
again,
capacidad ni
people
educación,
who
pues
do
sea así.
not
La
have
figura
capacity or
del médico de familia
education,
juega una regulación en todo esto.
without
Muchas
having a family
gracias
doctor, they would
y
not be able
sin
to achieve all
disculparme
of
que no me
this.
he
So
pasado de
thank you so
tiempo, pero
much. My
bueno,
apologies that I
me gusta
exceeded my
mucho esta
time, but
temática
I'm really
y un placer
passionate
estar con
about this
vosotros.
topic. It's such an
Gracias.
honor to be here with you
No,
today.
no, no te
Thank you.
preocupes, yo creo que estás justo a
Not at
tiempo.
all.
Creo que nos has dado una gran
You're right on
panorámica y yo creo
time.
que has
I
dado una
think that you
ponencia que
have given
nos
us a great
incita a diálogo y a
outlook,
las demás
and this
ponencias.
is a topic that is
A
going
veces
to
cuando el
just lead us
ciudadano de
to
pie escucha salud
really start
digital,
discussing more
piensa
about this.
que
So
son
whenever
cuestiones como
citizens
futuristas o
talk
lejanas
about
que no se
digital health, I think
cercanos a
that
ellos.
this is
Y creo que el que tú bases
a health of the future, something that is
los
not close
determinantes
to them. But
sociales
now
de la
they're
salud
just talking about
es
the
básico.
social
Comentarte que, pues bueno, aquí
determinants of
los fundadores justo de este
this
organismo
basic healthcare.
internacional, que es
Again, we
Salvador
have one
Allende,
of the main
pues tiene
founders
esta
here of
visión
this
de los
international body. We have Salvador
fundadores
Allende.
de la salud.
He had this
México, que es
vision of
el país
having these
de
social
referencia
determinants of
también,
health.
en
Mexico,
el
which
que
is
pues le
the
apostó justamente a las causas,
headquarters
a no
of the
esperar que las
CISS,
personas estuvieran
there was a
enfermas, sino
time where we were just
identificar
really,
cómo podían
really
prevenir
putting all of our
futuras,
efforts on the causes and
futuras
not really
enfermedades
waiting for
y
later
cómo la salud
when these
digital ahora
diseases
puede apoyar
are more
en
developed. And again,
con
I
este
think that this
propósito
digital
también.
health
La salud
um,
planetaria que mencionas, pues
concept could also
todos hablamos
help
del
us
dicho de
achieve
One
that.
World, One Health,
Again,
cómo es esta
we were
vinculación
talking about one world, one health,
entre
and how
tanto la
can we
salud
find the
planetaria
link
y el ser
between
humano y cómo
our planet and the
tiene que
human
verse de una
being?
manera holística
And how
integral.
can
Me
we
parece muy
approach this
interesante
more
tus
comprehensively,
intervenciones.
just
Yo te
more
pediría, por favor, si
holistically? So
puedes manejar
again,
esta
I
hora para
think
que al
that
final podamos
you
tener
had a
unas
great
breves
presentation.
rondas de
I would like to ask you to please
preguntas-respuestas.
stay
Y
here in
yo
the room for
ahora
a
pasaría
Q&A session at the very end. So now
presentar
I
a
would
nuestro siguiente
just
panelista, quien también
pass the
es como
floor
su exposición,
to our panel
a
member. I will
referencia
introduce
universal, al
him
doctor
first.
Pedro Cano
Thank you so
de
much,
Sandres, quien
Dr.
es
Pedro
médico y cuenta con una amplia
Cano
experiencia
de Sadres,
profesional
for taking our invitation. He has a lot of experience in technological solutions that can allow us to redesign healthcare processes with the participation of healthcare professionals, specifically for the elderly. He is currently the Director of Innovation and Strategic Projects of the Parc Santel in Catalonia Consortium. So, Pedro, welcome. The floor is yours.
Parece que tienes el micrófono apagado, Pedro.
Sí.
It seems that you are muted, Pedro.
Buen día, buenos días.
I'm sorry.
Es un placer participar en este
Good
diálogo
morning.
con
It's a
todos
great
ustedes.
pleasure for me to
Como
participate in this dialogue with you all.
Voy a
As
compartir con ustedes la experiencia
it
que
has been
estamos
said, I will be
teniendo
sharing with you
en
the
el
experience that we are
Parc Taulí de
having
Sabadell,
at
en
Parc
todos
Taulí
los retos que suponen el
of
envejecimiento y
Sabadell
las
and all the
necesidades que
challenge
supone
regarding
ese envejecimiento en
aging
Europa y en Cataluña en concreto,
and
para desarrollar una nueva realidad de atención integral
the
social
needs
y
that
sanitaria.
this aging needs in Europe and Catalonia in particular,
En el Parc Taulí
and
estamos
how
dando
we are going to
servicios
be
de salud y
developing
sociales
a
a
new
medio millón de
reality for
personas y somos unos
care.
5.000 profesionales
We
que
are
nos
around
dedicamos
5,000
fundamentalmente a un
professionals
hospital
that
de
are
agudo con alta
devoted to an
especialización,
acute
puestos de atención
hospital with
primaria,
high
un centro de
specialization,
investigación y un centro
primary
social para
care,
cuidar a adultos mayores
research
con necesidades de
center,
dependencia.
and social
El reto
center to
que se
take
nos
care of
plantea
the
en nuestra
elderly
sociedad
with
en España y en
dependence
Cataluña y
need.
en Europa
The challenge
es
that we have in
la población
Catalonia
mayor
and in
mayor de
Spain,
65
well, in
años, los
Europe,
adultos mayores de 65
over
años, se han
65-year-old
cuadruplicado en los
elder
últimos 120
have
años. Desde
increased
el
in
año
full
2001 hay más
folds.
personas mayores de
Since year
65 años que menores viviendo en España.
2001, there
Y
are
eso
more
está afectando a
elderly
nuestros sistemas
that
de salud y
living in
también a nuestros
Spain
sistemas
than those that
sociales.
are of a younger
La,
age. And that is having an
la
impact on
situación
our social
está haciendo
systems.
que haya una previsión
This
de
circumstance
estar creciendo más de 125.000 personas mayores en los próximos
leads
años,
us
con
to
lo cual
have a rate
la
of
estancia,
growth
la tasa de
that
crecimiento
will
que
be
estamos teniendo, pues
250,000
como
of
ven, nos plantea
elder
muchos retos
people
en el campo
over
de la asistencia de
65
salud, en cómo se
by
implementan estrategias de salud
2035.
digital
We will
y cómo
see
estas se
how
relacionan con los
digital
servicios sociales. Esto que
services
pasa
are
en
being
Europa y que
applied
para
to
nosotros es
social
una realidad ya
services.
hoy,
What happens in
bueno, pues
Europe, and
como
it's
ven,
a
no
reality
solamente
today,
pasa en
as you
Europa.
can see,
Este
not
todo el
only it happens
continente
in Europe,
africano, en el
except
resto
for
del mundo,
African
la
continent, in the
esperanza
rest
de
of the
vida
world,
está por encima de
life
los 80
expectancy
años
is
o muy cerca
above
de los
80
80 años.
years
También
old or
en
near
América
80
del Norte, en
years
América
of
Latina y
age.
en el Caribe.
In North America
Por lo
and
tanto, esta
Latin
situación que
America and the
estamos
Caribbean,
experimentando
it's
de manera más
alike.
avanzada en
So,
Europa
in a much
está llegando
advanced
también a los países que componen
way
el
we
ámbito
see in Europe, but we see
de
that
este congreso, de
present
este foro.
in the countries that are part of this
Visualmente,
Congress.
la pirámide poblacional ya
Visually,
no es una pirámide
the
poblacional.
population pyramid
Tenemos
is no
una
longer
situación en
a
la cual el
pyramid
baby boom
in shape. We
está
see that the
engrosando
baby
las capas de
boom is
población
really
a partir de
covering
los
the
50
layers of
años y esta
population as
progresión va a
of
hacer que de
50
aquí al
years old, and that
2043 en
progression will
Cataluña
lead us
tengamos
from
y en Europa
now
tengamos un
to
problema muy significativo de
2043
cómo
in
atender las
Europe and in
necesidades de adultos
Catalonia,
mayores que van
we will
envejeciendo
have a huge
con
problem of
patologías
taking
crónicas al
care
mismo
of the
tiempo que no hay una
elderly that
población
are
joven que sustente esas necesidades.
experiences those
Esto ha
chronic
motivado
pathologies,
que en
and that
Cataluña
there will be
hayamos
no young
diseñado, se haya
population
diseñado desde
that
la
will be
política del
at the
gobierno
bottom of the
de Cataluña
pyramid.
una política de
So the
integración entre el
government of
ámbito salud y el
Catalonia
ámbito
has
social, de
designed a
manera que
policy
incorporemos herramientas de
in such
transformación
a way
digital
that
para
we can
poder atender todas
include
estas necesidades de una manera
tools
más
of digital
eficiente y llegar mejor
transformation
a las
to
personas.
take care of those
Estamos
needs
hablando de que
in a much
en
more
un año
efficient
una
way and
persona
reach
mayor puede
out to
ser
all
atendida por
those
20
people.
dispositivos
We
diferentes,
can
tanto de
see that
salud
20
como sociales.
devices of
Y esto hace
health and
que el sistema sea
social
un sistema
can be
complejo
taken
en el que las
care of
necesidades
one
de
individual.
compartir información
We'll
entre los
see the
diferentes
need of
sistemas
sharing
pues es cada vez más
information
creciente.
among the
Y el
different
adulto mayor que se enfrenta
services is
a este
growing,
sistema de
and
salud y a
the
este sistema
elderly
social
that
muchas veces
is
esté
in the
desorientado y no sepa
social and
a qué
health
ventanilla, a qué
services
puerta debe
might not
acudir
know
para que
to
le resuelvan
which
sus
counter
necesidades.
he has to go to in order to
Siguiendo
have
con
his
este
needs
ejemplo,
met.
dentro de lo que sería
Following
el
this
ámbito
example,
domiciliario, las
within what will
conferencias
be house
dentro del domicilio de una persona mayor, de un adulto
care,
mayor en Cataluña,
within the
todos estos
house
dispositivos pueden
of that
interactuar
elderly
con él, desde
person
la atención
in
domiciliaria que viene
Catalonia,
de la atención
all
primaria,
these
el
devices
hospital de
can
día,
take care of
dispositivos de
him.
salud
We have
mental,
day
de
hospital,
paliación, de hospital a
mental
domicilio,
health,
en fin, toda esta
hospital at
panoplia
home,
de recursos. Con
and
lo
all
cual,
these
el
different
coordinar todos estos
services that you
recursos
see
en
on on the screen. Coordinating all of the services at a home level is really a huge challenge for the entities that take care of care. To that regard, we are developing for the first time the integration of system, health and social services. In the past, did not communicate between each other. For now, both departments of the regional government are working together, and they have been sharing health information, health data of some indicators and parameters that from the social view they need to share with the primary care staff, and then social staff can see some health parameters of that individual to take care of him, her in a better way. So we have an interoperability between the data information from those two departments. This is the challenge and this is the issue. I will present to you some good news that have occurred in this past years, and that has enabled us to have better tools than the ones that we have in the past. New technological capabilities. On the graphism, on the graph that I'm sharing with you, we see that from any part of the body, we have portable or wearable devices that will enable us to monitor some indicators or behaviors, and this affects the professionals of health and the citizens as well. So we have available a lot of tools to collect all this information. This is what happens in general population. In the elderly, we are seeing, and I share an article that was published in Nature magazine June last year, where we had a summary, a great summary of all the wearables devices that can be useful to follow up chronic diseases of the elderly, dementia, Parkinson, Alzheimer, impairment, visual impairment, and cardiovascular diseases. The amount of devices that are available to us to see what's happened to the elderly when they are not in the hospital setting, then it is great. We don't see only the individual, but we see his home as well. We are developing digital health devices that will enable us to increase monitoring capabilities of these chronic diseases parameters in the elderly. That can be from AI speaker devices, devices on the carpets, and the walls, assistance robots, and all devices that, as I was telling you, keep on growing. The challenge that we have before us is that all this technology has not been really put in place on prevention and care. And that is because, from my viewpoint, we don't triangulate the development of reviewed processes using the technology with the engagement of the people in two facets. One, professional health that are providing this service, and the individuals that will be receiving it as patients. If we do not put in place this technology in this way, then we will have a chair where you cannot sit down properly. You also need to engage families, caregivers that at home will be providing this support. So families, caregivers, technological companies, and service providers will have to work together jointly, as it has been described in the article of the Nature magazine, which is called Aging. In Spain, we are developing not only the gerontological system with economy, but there are specific studies to work in what they call gerontotechnology and how we can improve aging and without using the most expensive services of care that will be the hospitals. So I think that of interest to you is a follow-up through the teleconsultation or visiting and monitorization technology, GPS or radio frequency to see the location of those individuals, virtual reality, immersive reality, gamification, and serious games that can account for a very useful tool. And then you have sensors for IoT and domotics. Two examples that have been put in place in Spain. One is to use robots in a humanoid way to accompany the people that live alone at home and stimulate their interaction. This is example that you can see to the right of the screen, and we have robot pets for people that have cognitive deterioration issues. And then this is not a very high cost solution to put in place. Another thing that we can use for AI is immersive reality. That's another possibility. We have eyeglasses where one person can have an experience. With immersive reality devices, we can see that this virtual reality experience be collective. A set of patients or a set of users with their family will have the same experiences without being isolated from reality. This is a tool that reminiscence therapies and cognitive therapies, relaxation therapies, and mindful therapies are being used successfully for the people or patients that are using them, as well as for professionals. Another area is a project of the community of Madrid, providing tablets for certain individuals, some elderly, that from primary care are being monitored and that keep up with their chronic diseases. And on the Valles Occidental Est, that is a place where our hospital is located, we are having a transitory service at home, so the elderly could be discharged from the hospital ahead of time and continue his recovery at home, accompanied by professionals that will be assisting them in their basic activities, and then they will be able to go back home. Another example of AI is what has to do with an Alzheimer research. Alzheimer is a disease that was celebrated last month because worldwide, because it is a disease that is affecting the people over 65 years of age. The use of AI is being used to discover etiology, to have assistant diagnosis through computer, and as also to have different treatment approaches. All the sites that I am showing to you show the reference of the website to which you can have access to have more information because we are short of time. We also have Amazon speakers. That is, this smart speaker offers the elderly at home a series of routine that will enable them to monitor their cognitive status and will keep him doing some kinds of exercises to keep most of the time active. Patricia Pérez Rodríguez and Isabel Rodríguez Sánchez have published this article, and if you have the opportunity, I will advise you to read it because it has a summary of all kinds of AI devices, not only what I have shown you, but others as well. We are developing worldwide a new field of development that is technology for aging. That's age tech. I invite you to be attentive to startups that are really proposing solutions to this aging population. Undoubtedly, they will provide us with other tools that we can include in our AI solutions. The volume of financing of this startups, this is the financing that keeps on growing, and they are proposing other alternatives for health professionals and social professionals as well. Examples that I want to share with you. This is Andrea, and that is Sarah in the United Kingdom. So you can receive professional care at home. Beardy is a joint effort in the UK and Germany that is a tool to manage home care. We see that social care and health care have to go together at home. As Dr. Serrano has said, high complexity of care is driven now to the home, and that is why a joint effort is required. Something that will be more simple, that is Novi, that's a Belgian company. They can monitor the risk of fall at home. And I believe that you all know that falls are the thing that will trigger much higher risk care for the elderly. So we must monitor them. And then we have We Help, that is a French company that's providing home care. And then we have Florence in the UK that is having professional healthcare and social care at home. There are other examples of startups, and I think that they will be other unicorns that in age tech and health tech will provide us solutions, innovative solutions that could be tested and that could be included in our management toolkit in Latin America. So I encourage you all to work this type of startup and companies that undoubtedly will bring a lot of assistance. So I leave my personal information so you can contact me if you have any question or if you want further information. Thank you so much. There are so many things here at the conference. We have 6 technical commission for support for important topic on social security, and one of them is the commission for the elderly. I will share with them your entire presentation because I think that you have touched on a very important topic, a decent aging process, and how these new technologies can help us for that purpose. Some initiatives in Mexico could be put in place in Mexico and can lead us to have those good practices exchanges. Latin America and the Caribbean had the characteristic of having a young population, high birth rate, but that is changing. Now we have a lower birth rate, and then the elderly rate is increasing rapidly. And that has an impact on our sustainability, financial sustainability for pensions. And in this we heard from Cuba, and we were hearing how we could change that generational pyramid and the impact that we are seeing on Social Security. When we're talking about digital health, the debate is on the exclusion of all those individuals that because of a socioeconomic condition or age, this provision will allow us to include them. Yes, I see technology as an opportunity. I wanted to greet Costa Rica, if there are anybody from Costa Rica that is joining us in this call, because I have been working 1 year in that Latin American country. So a kind greetings to all of them. Well, I would kindly ask you to stay in the room so we can answer the questions at the Q&A session. Now I will have Dr. Grima Edwin, who is an expert on epidemiology and surveillance for health in the UASD, and has a master in superior education. He has a diploma degree in artificial intelligence and image learning in France. He has certifications in cybersecurity as well as offensive security professional. He has also managed Lorenzo Santa Cruz and key roles at a domestic level on health. Thank you so much, Doctor, and you have the floor.
Hello, good morning, good afternoon, depending on where you are. So now let's begin with our presentation. Next one, please. Can you hear me all right? Yes, sir. Okay. So the topic that was proposed for us to address here is related to AI applied to health by improving the accuracy, efficiency, and experiences when providing healthcare. So that's a brief summary of my resume. Next one, please. That's my personal experience, and now let's begin. So just by piggybacking on what my colleagues mentioned, whenever we talk about healthcare quality, well, it consists on the application of science and technology for medical purpose in such a way that we can just maximize its benefits for health without really increasing its risks proportionally. The extent of quality is, therefore, the measure in which we expect care provided to reach the most favorable balance between risks and benefits. So this was mentioned by Abedison Abeniad in 1980. He's considered to be one of the main founders of quality. We have another concept in this slide, which is key for us to be able to understand what is AI. Well, if you read the concept there, it is a discipline, a branch of engineering based on developing algorithms that are IT programs to try to address complex issues from a smart point of view. AI, for us to be able to understand this, may be similar to human intelligence or being a little bit far from it. At least that's the case now, provided that we can meet a purpose, since we know that AI or software are mainly designed to conduct a task. This means that the difference between human intelligence and AI is that we have human beings creating it to address complex issues. And the most important here nowadays, now as part of all of this, we know that this is the reasoning, the perception as well, and how we're applying everything that we have. Now let's take a look. Okay, so AI, according to this graph, we have some other concepts and other branches of AI, which are the ones that just help us nourish this one. And how we have machine learning, again, automated learning, right? These are algorithms that could learn from the experience of human beings. In the next slide, you're going to be able to see this. And then we're going to be we're going to see a series of aspects as well. You have deep learning, which is also part of machine learning, and it tries to imitate human beings through neural networks. So we have artificial neural networks as well, where we are just really creating algorithms and we try to emulate the functioning of the human brain just by thinking about the reasoning of the brain. Now let's take a look at the next slide. Let's try to explain a bit how this is done. What does AI need in order to function? There is a workflow. First, to your left-hand side, you're going to see people or experts. They're going to generate a lot of data. The more data, the better. All of this data needs to be labeled, right, and classified. So we need to have a database or data that is just going to be used for training, and then we're going to apply them and apply further data for us to be able to test this AI. Now, we're going to have automated learning, and later, as a next step, we will have as a prediction, well, we have the prediction or result model. So to your right-hand side, you're going to see another example where there's a human expert with a lot of experience, maybe one or more experts. They're going to make a request to work along with an engineer who is an IT engineer, a programmer, so that all of that experience of that physician is taken to a database, a knowledge base. And then they can put it at the use of a user that could be another physician or a patient or a user through a graphic interface. Now the user is going to interact with this software, with this program, with this intelligence, and then they're going to generate further information. So this is going to be stored in the same app or software. So if we're really talking about what is AI applied to medicine, AI in medicine is the use of automated learning models to search medical data and find knowledge that can help us improve healthcare results and patients' experiences. Next one. So what is applied AI or AI applied to healthcare quality? So now that we're getting into these new concepts so that we can really understand what's the main purpose of the message that we're trying to convey, let's say the information that we're trying to really convey here. So it is the use of advanced technologies, AI technologies to improve the accuracy and the efficacy of healthcare services in order to provide higher quality medical care. Here in the slides, you may see healthcare professionals Then in the first picture, you have an eye, picture of an eye, like we have always seen it. And then the next picture to your right, you can see how AI can detect, of course, based on training, prior training. So AI could find injuries or lesions in this picture. This may be, let's say, in real time. This could be some sort of a paused image. So they can just really pinpoint this injuries and they can just provide assistance to healthcare professionals for them to find pathologies that many times the human are not easily identified by the human eye. I mean, you may notice them, but only if you are highly trained in medicine or if you are a nurse or a resident physician that is specializing in that. So in that case, with the suggestions given by AI, then they can later just help us in a diagnosis. Another application that we see here, as an example, is the use of X-rays, uh, MT scans, and well, we see how AI is used to pinpoint the specific location of an injury, and then they can give us a suggestion of a given behavior, for instance. And now in the next picture to your right, there's a doctor. I had the chance of meeting him, Mr. Ahmed. He is a great colopatologist. He is now using VR, AI in his surgeries whenever he performs them live for everything, whether at a hospital, at a university, or maybe in doctor's training, specifically to explain how a surgery is performed. And this is used to just train doctors. And again, we can apply AI in the healthcare domain for these purposes.
Asimismo, otra de las aplicaciones
Now, another application is a diagnosis, a customized diagnosis and treatment. Usually, well, we had this imaging diagnosis, it allowed having a customized treatment. And then in this picture, we can see that there are three doctors, they're experts in the Children's Hospital in La Paz City. And to your right hand side, we have a resident doctor. He is in training. So we see this ultrasound imaging. They're using now AI to find what are the parameters. And now what they're doing there is that they're just cross-checking information, them as specialist doctors. And also we're just managing electronic data and records. They just automating administrative tasks, let's say reminders and just patients visits, and well, they're just mainstreaming and just optimizing all of these workflows just by predicting, let's say, cases whenever there's some sort of an epidemic outbreak. And then we use AI whenever there's an increase of, let's say, cases of pneumonia or dengue, or, well, we have also with the pandemic of COVID-19, we have noticed that AI can also help us really find that there are other, let's say, ways to apply all of this. So next one, please. Okay, so more specifically, as part of the disciplines that are applicable to healthcare, we have artificial vision. This is a software that tries to use an algorithm that is a smart algorithm, and it tries to understand everything that is just seen in a video or a picture. We as human beings were capable of detecting all types of situations and
por todo
objects,
tipo de
right?
iluminación y para cualquier
Regardless
tipo de
of the
recurso.
lighting for any type of,
Por
uh,
desgracia, en
let's
estos
say,
momentos la
target
inteligencia
object.
artificial
So
sigue
now,
en
unfortunately,
evolución.
AI is still evolving,
Todavía no puede compararse
and it
con un
cannot
ser
yet
humano,
be compared to
pero
a human
tenemos la
being.
esperanza de que
However,
dentro de
we
unos,
have
puede
this
ser
hope that
meses o un par de
maybe
años,
in a
esto
couple
pueda ser
months or in a
logrado.
couple of years,
En
and this
concreto,
is going to be possible. So,
son modelos
more
de inteligencia
specifically,
artificial
these
que
are
realizan
AI models that
sola
are
tarea. Por ejemplo,
just
les hablaba
performing
del caso
one single task. We were
de los
talking
fondos
about,
de ojo, ¿no? Entonces,
let's say,
tenemos una inteligencia
eye
artificial
pictures.
para
Well, we see
detectar, por ejemplo,
this AI
patologías
used
en
to
pacientes
detect,
diabéticos,
let's say,
como la
pathologies in diabetic
retinopatía
patients,
diabética,
and
también la retinopatía en pacientes
well, also we
hipertensos,
know that
puede
hypertense
detectar, ¿no? Esto en
patients,
base
they
a un
can also
entrenamiento.
detect all of this
También
is
patologías de
based
tórax,
on what we're doing. This
patologías
is based on training and, let's say,
neumológicas.
thorax
Existen
pathologies
entonces
or
esta
pneumological
aplicación
pathologies. And so this
como
application
soporte al
as
diagnóstico en imagen clínica.
support to this
Por el
support
momento,
is,
yo
well,
creo que
pretty
así se va a
useful. So
mantener.
to
Una
this date, I
inteligencia
think that this is going to
artificial
remain like it is.
nunca va a
AI
dar un diagnóstico
may
o
never give
nunca va a
you a
reemplazar al ser
diagnosis.
humano,
It will never
¿ya? Porque
replace a
el ser
human
humano tiene
being because
mayores
we know that
capacidades,
human beings
pero
have,
sí nos puede ayudar a
let's
reducir
say,
tiempos en el
Spanish skills.
diagnóstico,
We have
dándonos
more
soporte.
skills.
En este
But
caso,
however,
con la
you
resonancia
could use this,
magnética,
of course,
en la
in addition
ecografía,
to,
en
let's
una
say,
radiografía, en
MRI
una
or an
tomografía
X-ray or
computarizada, en
and all
microscopía
types of,
también,
let's say,
que
imaging
ya se ocupa
and
bastante, en
all
imagen
of
de
this
color.
microscopy
Otra de sus
uh, tests
aplicaciones
and
es el
other applications that we
análisis del
have
movimiento como
is the
prevención de
analysis of movement
lesiones
as
y rehabilitación.
a
Como
form to
podemos ver en la
prevent
segunda imagen,
injuries,
es
as we may see in the second picture.
culturista que está haciendo ejercicio
This is a
y a su
weightlifter.
derecha
He
ya la
is
inteligencia
working
artificial
out. So now with the
está no
use of
solamente
AI,
siguiendo esta imagen
we're not
o
just following, let's say,
este video de cómo
how
el culturista está haciendo el
a movement
ejercicio,
is
sino también
done by
puede
the weightlifter,
detectar a
but
través de una
now
alerta,
AI
una
can
alarma,
help,
si
let's say, just
la
warn
persona
or
está
trigger some sort of
realizando
an alert
correctamente
in
o
the event the weightlifter
incorrectamente
is
el
not doing
ejercicio
a
para poder
movement
así
properly, or
prevenir
if
lesiones. Por
he
ejemplo,
or she is doing this
deportistas o las
movement
personas
properly.
que
So
realizan
this may be
este u otro
maybe
tipo de
just an
ejercicio.
athlete or
En la
just
siguiente
any
imagen,
even
más
person that
abajo,
could be
podemos
just
ver
doing this
una
type of
persona que está
exercise. So
realizando
now
ejercicio
at the
físico
bottom we
y de la
see
misma
again
manera
a person
a
working
través de
out,
esto la inteligencia artificial
and in the same
ya nos
way AI
muestra
can help
la
us
posición
see what's the
de la persona
positioning
y esto
of a
sobre el
given
objetivo
person.
también
This with
de
the intent that
realizar una terapia de rehabilitación física.
some sort
¿Ya?
of
Y
physical
como otra de
rehab
las
therapy
aplicaciones
is taken. So
de
other
las disciplinas que se
applications
aplican a la
that are
atención en
part of this
salud, vemos lo que es
discipline
el
that is
soporte a
also
cirugía en
using
tiempo
AI,
real.
well,
¿Ya?
is specifically, let's say, whenever
Donde
we
el
are performing
cirujano a
surgeries in
través
real
de
time, where
una
a
cámara
surgeon,
o un Google
by
o
using a
unos goggles
camera
de
or
realidad
Google
virtual
Lens
puede no
or
solamente
VR
estar
lens, they
grabando la
cannot
cirugía,
just
sino también
record the
transmitiéndola
surgery.
en tiempo
They can
real en vivo
also
y
just stream
gracias al
it
internet puede ser
live, of
visto
course,
en cualquier parte del
online. Now,
mundo
thanks to the
y
internet, we could
también
just
la
really stream
inteligencia
it anywhere
artificial
in the
ya
world. And now
en la pantalla
AI
le puede estar
on our screen
dirigiendo o sugiriendo al
could be just
cirujano
suggesting a
posibles, por
certain
ejemplo, al borde de
possible, let's
algún
say, things.
tumor
Let's
o
say
algún vaso
maybe if
sanguíneo
there's
muy
some sort of
importante
a
para tener
tumor
precaución.
or some sort of
Siguiente, por
a,
favor.
let's say, any sort of malignancy.
Otra de las disciplinas aplicables a la salud
So another
es el
discipline that we see
procesamiento del
is the
lenguaje natural,
processing of natural
¿ya?
languages.
Es o en NLP en sus siglas en
So this
inglés,
is NLP, what we call
es
natural
comprender
language
el lenguaje
processing.
humano. La
This is for us to
inteligencia
be able to
artificial
understand
trata de
human language.
comprender
AI really tries to understand
cómo nosotros los seres humanos hablamos
how
en
we
nuestro
as
propio
human
idioma.
beings
Es
speak
un
our own
modelo
language.
que
This is a
trata de
model
que entiende
that
el lenguaje
tries to
escrito
help
o
us
el lenguaje
understand, let's
hablado
say,
y puede ayudarnos
spoken
en muchos
or,
casos si lo
let's say,
aplicamos a
written
la salud.
language. In many
Esto es
cases, we can apply this to
un software
our healthcare provision.
piloto
This is a
que lo
software. It
realicé
is a pilot test that I
donde la paciente a través de
run. This
una
was a
videollamada
patient we were doing a video call
tiene una consulta médica
for a visit, the
puede ser
doctor visit.
con un chatbot o puede ser
It could
con
be either with a
con
chatbot
inteligencia
or
artificial en
with
video,
just
como se ve en la
video
imagen,
AI, like we can
y
see in this
la
picture.
inteligencia artificial
And then
va
AI is going
llevando
to
ese texto
help us take this
hablado
text,
a un dato estructurado en tiempo
text
real.
that is being spoken. It is going to be just
Procesar audio
restructured in real time. It could also
texto y
process
ese texto
audio
análisis
and
estructurado.
transcribe it,
O
and
también
then give it some
procesamiento de
structure,
video
or also
a
video
texto y a dato
processing,
estructurado.
video to text,
¿Ya?
speech to
Entonces,
text, in a more structured way to get data from it. So there are many
artificiales
uses
en
given
el
to
mundo
AI.
que han sido desarrolladas por empresas y están
AI
tratando
that
de
has been
aplicar
developed
esto,
by
¿no?
many
Entonces,
companies, and we're just
esto, como
seeing
les
its
digo, es un
application.
piloto
So again, like
que
I
se
said, these are
realizó
just pilots, like this
ya
one
hace el año pasado
we did
y
last year,
está todavía en modo de prueba.
and it's still in
Siguiente, por
trial
favor.
mode.
Bueno, otra de las aplicaciones ya terminando
Another
están los
application, just to
modelos
wrap it up,
predictivos
we have
de
predictive
aprendizaje de
machine
máquina
learning
o aprendizaje
models.
automático. ¿Ya? Existen modelos
There are
matemáticos o modelos
mathematical models,
predictivos que son
predictive
programas
models.
informáticos basados
These
en
are
aprendizaje y modelos matemáticos que
software
ayudarán
that are
a
just
predecir qué va a
based
pasar
on
en tal
mathematical
situación o qué va a
models and
pasar en un
learning
determinado
that help
tiempo,
predict what's going to
semanas,
happen in a
meses,
given
años.
situation
¿Ya?
or time, weeks,
Existen
months,
diferentes
years.
modelos como de
There are different
clasificación, de
models. It's like
regresión.
the one where we
Estos
see
son
some
ejemplos o son
classification,
ejemplos
regression.
que he
These are some
utilizado
examples
y
to your left-hand
existen
side. You may see those that have been
técnicas,
used
¿no?
by us, some
para el
techniques
procesamiento, como está el
that
árbol de
have been
decisión, las
used for
redes
processing, like this
neuronales, la máquina de
decision
vectores de
tree.
soporte,
This is
análisis
the
bayesiano,
support vector
regresión,
machine.
etcétera.
We have
¿Ya?
this
Esa es otra de las
um,
aplicaciones de la inteligencia artificial,
Bay
que son
analysis.
modelos predictivos. Siguiente, por favor.
And well, again, this is part of our predictive
Bueno,
model.
beneficios de la
Now,
inteligencia
what are the
artificial.
benefits of
Mejora la
AI?
precisión
It
diagnóstica,
improves
ya, o sea, dando un
a
mejor soporte, reducción del
diagnostics
error
and
humano,
diagnosis accuracy. Let's say it
el error
minimizes human
del
error
personal de salud,
of the healthcare
eficiencia y ahorro
professionals,
de
and
costos,
it
mejora
is
en la
cost
experiencia del
it will
paciente,
save
como
costs.
el
It is
ejemplo de los
cost
chatbots,
efficient. It
existe
improves the
monitoreo
experience of the
continuo del
patient with
paciente,
chatbots. We have
por ejemplo,
continuous
muchos
monitoring of
tenemos
patients.
estos aparatitos
We
en la
have these
muñeca
small devices
donde
that we
nos va
can wear
dando,
on our wrists
va monitorizando los signos
for us to
vitales
be
del
able to
paciente
monitor
y
the
puede
vitals
ya
of our patients,
emitir alertas
and then
o
we can just trigger
recordatorios tanto
alerts or
para el
reminders,
paciente o como para el personal de salud
either for
para
the
poder brindar
patient or
una
for the
atención
person
médica
or healthcare
oportuna.
professionals, so that we can
Ya,
provide timely
también
medical care.
el tratamiento va a ser más
And we
personalizado,
know that treatment is
personalizado,
going to be
ya que
more,
va al hacer un
let's
monitoreo
say,
constante
tailor-made or
de nuestro
customized,
paciente, nos va a
since
ayudar
since we're
a
going to
realizar ciertos
monitor our
ajustes
patients on an
en el
ongoing basis, that
tratamiento,
it's
la
going to allow us
conducta,
to just
¿ya?
make some
Reducción de
adjustments in their
infecciones
behavior and other
hospitalarias y el
things. We're going
paciente
to
ya
minimize
no tendría que
hospital infections,
asistir
because
por
patients
una
do not
consulta
need to
regular al
go
hospital,
for
sino
a
la podría
regular visit to the
recibir en su
hospital. They
domicilio
could
a
just do it
través de
at
una
home
teleconsulta
through
o una
a tele
teleinterconsulta con alguna especialidad o
visit, let's say
subespecialidad.
telemedicine
También
visit,
ayuda a
or
encontrar
maybe with an expert.
tendencias y
So
predecir
it could also
epidemias
help us find
gracias
trends and predict
a los modelos predictivos.
epidemics
Siguiente,
with
por
these
favor.
predictive models.
Tenemos desafíos. ¿Cuáles son los
We have
desafíos
we have
para la
challenges.
implementación de la
What
inteligencia
are the
artificial en
challenges when it
salud?
comes to
La
deploying
privacidad y
this
seguridad de los datos,
healthcare
¿ya?
AI? We have
Integración con
data
sistemas
privacy and
existentes.
security,
Actualmente
integration with existing
tenemos
systems.
múltiples sistemas,
We currently
pero no
have multiple
existe
systems. However, there is
esa
no
interconexión o esa interoperabilidad entre los sistemas que
interoperation,
hay,
no,
ya que muchos sistemas
let's
son
say,
creados o
integration.
diseñados con
Many of
software
them are
privativo
created or
y
designed
entre software y
by
software muchas veces
private software companies, and
no pueden
sometimes
ser
their
integrados.
softwares
Así que
are
muchas veces una
not
empresa que
agnostic,
crea
they
un
cannot be
software, un
integrated. That means that
dispositivo no es
if we
compatible con
create
otro.
a software or
Pero
a device that is not compatible with
una de las
another,
soluciones es utilizar software libre
then
y
that means that one of the solutions would be using
en un mismo lenguaje de
free
programación
source
para que puedan
software
interactuar de esta manera.
with the same
Otro de los
type of
desafíos es
programming
la
language
calidad del
for it
dato,
to be able to
ya
be
que es muy
compatible.
importante
Now, challenges.
la
The
regulación y
quality of data and also domestic regulations and standards when it comes to applying AI to the healthcare process, and also certification, validation, and standardization by the authorities when it comes to the use of AI, its adaptation by healthcare professionals, because today we still see some reluctancy when it comes to applying AI to digital health. And another challenge is the medical responsibility, since possibly AI is going to suggest, let's say, a given pathology or behavior, and then it's a doctor who would be given an order. And well, we need to see whether we're really going to determine who's responsible for what. I mean, either the AI or a doctor. Another challenge of, let's say, the ICTs and AI investment in technological infrastructure. It is very important to make this investment both in the government, with the different institutions, with social security, for us to be able to make the implementation of this technology in healthcare centers, hospitals, acceptance or embracement by the different populations. Well, after the pandemic, we know that this embracement has been accelerating by the population, let's say, to have these televisits with other professionals who are not, let's say, in the same location. Another challenge is the accuracy that we need to see in AI versus the accuracy of a human being. So future outlook, again, just to summarize, the investment in technological infrastructure, possibly we need to have, let's say, some sort of agreements with different countries for us to be able to just really improve technological infrastructure, embracement by the population, self-learning, integration with nanotechnology, better remote monitoring. So we're still improving nanotechnology to treat pathologies like cancer and many others, to also minimize tumors. We have a better remote monitoring, specific standards for AI. Currently in Bolivia, the authority controlling, let's say, Social Security, or CISS, last year issued a technological standard for informational system management in healthcare facilities and for Social Security purposes. So in the short term, they did this because they were in need of a standard that could just standardize all of this technological information and the data that is stored in these systems for them to improve the data, the quality of their data. So even though there are challenges when it comes to its deployment, the potential benefits make AI an expendable tool for the future of healthcare. A continuous evolution and embracement of these technologies promise a future where healthcare quality is optimized significantly by improving results for patients and the efficiency of the healthcare system as a whole. Thank you so much for your kind attention. My name is Dr. Germán Lojordan from Bolivia. I appreciate your kind attention. Okay, I had a technical problem. My apologies. Thank you so much, doctor. I just really want to thank the contact that we managed to do with you and Melissa. But it's really, I had the chance of just listening to one of your lectures on the quality of healthcare for patients, and it is very interesting to see how this concept has evolved in the Latin American system. It is not new that there is not there are not enough healthcare professionals to really cater to the needs of the different populations and to really streamline the time by using these technologies is a great opportunity that we have at hand. So the last slides are really getting they really caught my eye. I was discussing this with my team. I think that it would be really nice to have a good regulation on data privacy, and we really need to focus on technologies and the trust that you were mentioning, how to really help beneficiaries when it comes to embracing these technologies. And later on, we could talk about this ACES technological standard that I think that sometimes laws are not enacted at the same time that when a given need is emerging. So we know that if we have this regulatory framework, then we know that all social security systems now need to just really address this topic related to AI. So I would to ask you to please stay here for the Q&A session. And lastly, I would like to introduce Mrs. Bernadette Isabel Cotrina Uteaga. She is a radiologist. She is a key person when it comes to the development of telemedicine in Peru. Since August 2023, she is the director of the Telemedicine National Center, or SENATE. Health, I already mentioned that she's our manager for over a decade of experience in digital health. She has been the first telemedicine director in the country. She has headed key projects in the Ministry of Health, such as the Contigo program or With You program, the General Director of Telehealth. He has a master's degree in public health management and a doctor and a PhD on health management and studies in IT and global health. She has been just awarded with different awards, of course, such as Creativity in 2014, the Cal in 2017, for the early diagnosis of cancer in children in Peru. She has represented her country in international telemedicine events, including the Symposium Towards the Pacific in China in 2015. She will also be just part of the modernization and digitization of healthcare services in the country, just by really focusing on medical healthcare. Thank you, doctor.
Thank you very much for the introduction, and I want to thank again for allowing me to join us today in this Social Security Conference. I bring the greetings from our Director of Health Ministry, and we thank the organizer Hipólito Vilches, Dr. Brandon Perez, Dr. Oscar Perez. Well, the space that we must cover is digital health, of what we have been working in Peru with Social Security. For that purpose, I would like to show you this first slide to tell you how we are organically positioned in Peru. In Peru, we have the executive. As Social Security, we depend from the Ministry of Labor and Promotion of Employment and not from the Ministry of Health. SENATE is an organic area within the Social Security that was born back in 2014, and in 2015, the change of the rock becomes a national body. Or organic structure is one directorate and two management branches that have to do with the operational part, and this subdirectorate of operational in health. Then we have digital health from telehealth at a national level, and we have a branch that since 2016 created a law that has definitions, but the most important thing that we have right now in the panel is that the law defines there are four strategic axles or components: teletraining, one of them, to strengthen the capacities of the health professionals, using technologies that TELIEC, that is very important, that we have deployed in SENACE, that it has to do with information using technology, but aiming a population at large. And then management, and that allows us to manage health services, and telemedicine, it is that one that will be providing the health services. At the telemedicine, we have around 20 specialties. You see that we provide all those services according to the law in Peru. The care is around 964,000 cares that we have provided at a domestic level, and we created strategies according to the need that has been identified at a social security level. And this slide will summarize how we have been deploying our work vis-a-vis the issue of access gap in comprehensive care. In front of that, we have created Telecam, where we provide tele guidance for the elderly. Or Social Security in Peru has three types of services. One that is the pure sanitary health service. The other one is the social. Here we include the disabled and the elderly. We provide comprehensive care for them. And the other one is the financial one that has to do with subsidies. This is the telecom work that includes sanitary and social provision. We provide this tele-guidance and telemedicine to the elderly in nutrition, rehabilitation, so they don't have to go to the health services institutions. Then, on the context of the medicine emergency that was suffered worldwide, and well, Peru was not an exception, and we had to deal with the dengue outbreak. So we created teledengue with nursery staff that, according to the norm, to take care of those patients that presented that they were prone to dengue, or in which we had identified dengue. We have Teledot, and that is where we have guidance. And to close the gap, we have the Senate Center that has been working with telediagnostics. That is one of the services that led us to create ourselves back in 2014. We have radiology, we read telemammographies, and we have added telecoloscopy, and that is called telecop. And we have also created teletriage and tele-emergencies, so physicians can really screen our patients. The physicians would be in the telecenter, and then we will have the patients at the centers. We have 4 and 5 screening levels, and that we can take care of the levels 1, 2, and 3 at the centers. We know that we can create an extension of priorities. And what we have done is we created a modules. Modules are booths that were used frequently in COVID. So the persons that were insured could be tested for COVID to take care of this worldwide. So those booths, we have changed its aim, and we can have computers, we have video conference, so the patients inside that telemodule could receive the care during tele-emergencies and tele-screening. So now I will tell you how we have been working each of our strategies. This is Teledot, what you see on your screen. It's very important to tell you that in year 90, the Pan American Organization of Health, knowing the issue of having a patient with tuberculosis and how long it took to take care of that patient, because at the time that patient would have to be observed when taking its medicine by the nurse staff. What have we done with the platform with the use of clinic history? We register our patients, nurse staff at the center of health, and the patient ensured that has that diagnosis of tuberculosis wherever he is found, at home, at work. He can be monitor when taking his medicines. We are really enthusiastic because we are found in 144 IPRES of around 400 in the Social Security. We are taking care of around 24,000, and we are preventing our nurse staff to be contaminated. And above all, we are looking for the satisfaction of the final patient, because he does not have to go to the center and doesn't have the expense of going to the center. Now we have also tele-rehabilitation, tele-RHB, for physical rehabilitation and language therapy. And we're taking care of the most vulnerable, or children and the elderly. Children, when they have a deficit of language, an alteration in their motor system, we go to the expert and we provide this care for those that are in faraway locations. When we have any kind of tumor or any kind of trace of that tumor and they need to improve their language, we also provide that intervention. We are really excited because we have had 8,885 patients taken care of. We have been deploying what we have on the screen, the telecoloscopy. We have called it synchronic and asynchronous telescopy. In Peru, have regretful numbers in uterine cancer. One Peruvian, according to the diagnostic, dies because of this health issue. If we had a massive vaccination to all of our regions and we could diagnostic timely, we could be healing them. And that is why we created this telecoloscopy. So we have an expert committee and we work under the culture of experts in telemedicine, and we call for the president of gynecology of Peru and the chair of the Coloscopy Association, the chiefs of departments of gynecology, and they were the ones that trained the general physicians so they could take the imaging and then have a flow of care and follow up with the patient that would have been diagnosed. We are recently publishing an article, a research article that will have an impact on public health. Our objective is to assess the impact in telecoloscopy and identify all these lesions. And then the population that we are working with are women that have been screened thanks to that intervention of telecoloscopy. We still have a small number of patients which we have intervened, but it is important to show you this result because interventions and their outcomes are very important. 26.97% have pre-malignant lesions, 1.12% carcinoma, and 44% of benign pathologies. We see that 93% of satisfaction is obtained in the use of this telecoloscopy. So it has a positive impact in the detection of CACU, and that this result shows us how efficient this tool is and that it should be deployed in our entire territory and why not in the region. What we have been proving to tele-education from SENADE, it is telemedicine, but as I was saying, we have a frame law, teletraining, and telejec. We provide information for health learning for our population, creating Teleeduca. Teleeduca is an e-learning platform providing remote education. We will be providing the right information, and we will break the barrier of or ensure the patient. We are trying to provide education to all people at large. We have different topics. These courses have a modular structure that are quite interesting in a very visual, ludic way. We'll be providing these topics dictated by experts. At the end, they are some surveys so they can really receive a certificate of participation, and then they can scan the QR code. And this initiative, we are really reaching a number of 6,000 enrolled persons. But Telemedicine Center, with the time that it has been in place, has been also developing its activity according to the quality management system that is embedded. We have an international certificate that we received back in 2022, ISO 9001, that has the scope of certification to remote health services. For this to be possible, we have 8 components that are the requirements that we must meet in order to keep this quality management system. The first component, we are always looking for a standardization, measurement, and improvement of each of the processes. At SENATE, we have established the processes and guidelines and responsibilities of the professionals that are executing them. We have objectives and quality indicators that will enable us to measure the objectives that we are setting each year. Then we take care of claims, a social security. Then the end user can put in a claim, a suggestion, so at a moment in time, we can put in place an improvement. And then SENACE, well, can also receive claims. So through quality service, we will be adopting corrective measures, but normally we focus on preventive measures. And then we measure satisfaction. When an intervention has been made or a new strategy has been deployed, we ask the end user to tell us about their satisfaction. Then we have medical audits. We will be auditing the clinical histories or the clinical dossiers that have been done on the virtual visits. The non-conformities are the deviations of that we can have or the gaps that we can have and that can be existing according to the process that we put in place, and that they have to be identified quickly so we can have preventive and corrective measures in place. And we work on ongoing improvement. Because we have a quality service, we can identify and execute improvements because we work very firmly that for telehealth will be the catalyzer cross-section to each of the services that Social Security provides. Here we have an image of the last satisfaction survey that we gave our users according to the different services. And here we can put it to different users, the establishment of health, IPRES, or the teleconsultant physician, and the final user that will be the patient. And we have an average of 90% satisfaction. So we are quite satisfied because in the country we have become recently in the first IPRE that provides virtual services in Peru. We have been ranked of the registration of virtual service provider on health in Peru. And to close my presentation, I will leave you with a short video that lasts 3 minutes of all the work and strategies that we have been putting in place. But since an image is worth more than 1,000 words, I hope that this video will provide you with much more appropriate concepts.
Desde hace 10 años, en el Centro Nacional
Since 10 years ago, at Senate, from the Social Security, we have been working sustainably in telehealth. Thanks to telemedicine, we have carried out over 1,700,000 virtual visits on tele-expertise and tele-emergency throughout telemonitoring with strategies as Telecrom, Teledengue, and Teledot, or nurses who have accompanied the patients throughout support in monitoring to avoid complications in their health. Sorry about that. I think that the video was not properly shared. If you would kindly play the video again. Sorry, it started, but then it was interrupted.
Un momento, por favor.
Just a second, please.
Si se visualiza, vamos a volver a pasar, por favor.
We'll play the video again. Thank you. Since 10 years ago, at the Telemedicine National Center, Senate of the Social Security Service, we have been working sustainably on digital health with telehealth. Thanks to telemedicine, we have carried out over 1,700,000 virtual visits on specialties, screening, and teleemergencies throughout telemonitoring with strategies as Telecrom, Teledengue, Teledot, or nurses have supporting continuously the patients that require monitoring in order to prevent complications on their health. 2024, we have done 53,000 visits. Telesupport to diagnostics has been reading 1 million imaging of telemammography, teletomography, and added to all of that, the teleinterconsultation or visit links the assistance health providers. With this virtual visit, we can have telecoloscopia. We have increased access to early detection of cancer in the uterus, teleorientation on psychology, nutrition, teletherapy, and language therapy. Thinking in our elderly population, thanks to telecam, they will be receiving care through teleorientation or guidance in the centers devoted for the elderly, improving their quality of life. 2020, they are part of the 480,000 teleorientation or guidance that have been provided to increase the knowledge of health professionals. We have teletraining and axle of telehealth that enriches the practice. And since we have an engagement commitment with our population, all Peruvians can have free access to teleeducations thanks to TeleLC through Teleeduca that provides knowledge in order to teach health. As it has been proven, CISS strategies are our commitment to everybody's well-being. In CENATE, we humanize technology to provide health.
Muchísimas gracias por la atención.
Thank you so much for having played the video, and thank you for your attention. Thank you, Dr. Agudis, for areas for healthcare and digital health that CENATE has. It's quite interesting, and particularly for the vulnerable groups as children and the elderly. Since we've reactivated the sub-regions, we have been hearing different spaces and bodies of health, and that is quite enriching for us as conference. We have exceeded our time, but not to have a further delay. I will only ask 2 questions that we have received for each one of you, and I will make them in the order in which you made your presentation. Dr. Jordi.
So here we have a question regarding the fact that you talked about the key role that a family doctor has in digital health to prevent inequality. So the question is if the education profile of healthcare professionals is to change now if we consider this digital health component, because now the new family doctor profile includes digital health as a basic topic, just care and this type of tools. And also we heard outstanding presentations in terms of Ecuador and Peru. You were talking about the role of the authorities, local authorities, to really start just embracing this digital technology tools. Yes, thank you. It's such an honor to hear from our colleagues. I've learned a lot. Well, it's very recent that universities started just including this subject of digital health in the School of Medicine, but now this is changing very rapidly. Now, it is also clear that AI, generative AI, is and will keep on changing this even more. So if healthcare professionals are not educated with this AI, they're going to be replaced by others. So I think there's a microphone open.
hay un antes y un después en los últimos 2 años.
So again,
Y la mayoría
over
de
the
facultades de
past
medicina
2
ya
years, this
incluyen
has
en
been the
sus planes
case, and now schools of medicine are
lo que es la
including
salud
this
digital, ¿no? Lo que
subject
pasa
of
es que hay un
digital
gap muy
health in their
importante,
curriculum. So
que
now
es que hay una
there's
generación de
this huge
médicos
gap because we see this generation
todavía muy jóvenes que no ha
or classes
sabido,
of doctors
no ha sido
who are
instruida
pretty young.
y a veces,
They are not really
paradójicamente,
that trained, and
se encuentran
paradoxically
pequeñas
speaking,
bolsas de médicos jóvenes,
well, you
jóvenes,
may
que
find
no
some
están muy
groups of
instruidos, ¿no?
young
Pero bueno,
doctors who are
en ese
not really
sentido,
well trained.
tanto las
So
autoridades como
both the authorities
ahora ha explicado muy bien, ¿no? Bernadette, o
and
sea,
like
un buen
Bernadette
plan
mentioned,
nacional
if we have
y
a
una buena
good national
implementación implique a
plan
todas las autoridades,
with a good
pues hace
deployment by the
una gran
authorities, all of
diferencia, ¿no? O
that is
sea
going to
que
make the whole difference.
yo creo que no hay vuelta atrás,
So I
que
think
la
there's no
educación en sistemas
there's no going back
digitales
really.
es
So
y hasta aquí va a
more
quedarse.
digital
Yo no
education
creo
is
ya en
something that
salud
is that
digital, yo creo que
has
en
come here to
salud
stay.
utilizaremos
Now
la
I think
tecnología.
that digital health
En cuanto, en
needs
cuanto
also to
al
use new
debate de
technologies.
Perú, ¿verdad?
Now,
Bueno, eso es un centro
concerning
de
Peru and Ecuador,
investigación
this is a
del sector
research center,
planetaria, aprovechando los
planetary
conocimientos
health. Now,
de las poblaciones
just piggybacking
locales y
on the
autóctonas
knowledge that
y
has
en
been
ese
shared by
sentido allí
the
también
local and
se utilizarán nuevas
autochthonous
tecnologías para el
populations.
tema
That's
este de
where we also
medicina,
see how
pero
the
es más
technologies
bien
are
un
used
centro
specifically for
que intenta
medicinal purposes.
integrar los
But it's
conocimientos
more a
locales y
center
autóctonos de
that
esta clase de
makes the
poblaciones
integration of local and autochthonous
indígenas, bueno,
indigenous
para
knowledge,
también
specifically
sacar el máximo
to
provecho en cada
provide care
situación.
and to really
Todo el mundo es
maximize
diferente y no es lo
all of
mismo una
this knowledge
población
to the most. And
del
we know
Alto
that
Perú
everyone is
que una
different. The
población de una
population in the
ciudad como
highlands of
Sao Paulo.
Peru is
Cada
different
población
from the
debe
population that
respetarse
we see in a large
su
city like Sao
antropología,
Paulo.
sus
So each
conocimientos
population
y
needs
la
to respect
personalización
its
de la sanidad
anthropology,
no
its own
solamente
knowledge,
pasa
and really
por la medicina
creating
predictiva,
or
preventiva,
providing this
sino que pasa
tailor-made or
precisamente por
customized healthcare provision is not
el
just
conocimiento
considering
de
predictive
qué
and preventive
aspectos
medicine, but it is also
socioculturales, ¿no?
considering
son
the
necesarios
social,
para
cultural
posibilitar la
aspects
medicina, ¿no?
that are required to
Y bueno,
provide
en
this
este
healthcare.
caso el
And
centro
that's pretty
precisamente
much
para eso.
the main reason why this center was
Muchísimas
created.
gracias, doctor. Una disculpa,
Thank
yo
you so
tenía
much,
aquí el micrófono
doctor.
abierto.
So I'm
Me
sorry, we
parece muy
had a
interesante
microphone
esta
open
presentación
indeed.
del perfil de
So I think that it
especializados
is very interesting to see how this
dedicado a la salud y cómo deben de
medical doctor is
actualizarse con
going to
este tipo de
change
tecnologías y
their
como ya lo
profile.
mencionó usted, pues la
So, like
protección
you already
de las
mentioned,
comunidades locales para poder hacer
just
uso
really
de estas,
allowing all of these local
herramientas.
communities
Doctor,
to
para
really
hacernos igual dos
make use of
preguntas.
this tool.
Una de
So
ellas
again,
es dirigida a
doctor, I
usted y la
have two
segunda
questions. One
la
is
vería a
for you,
todos,
and the
porque
other
es
one is
una
for
de
everyone.
gran importancia para el país,
So
para México.
we're
La
talking
primera, doctor,
about,
es sobre,
let's say, what we're going to
hablaba
do,
sobre
let's
estos
say in
dispositivos
Mexico. So you were talking
portátiles
about this
para adultos mayores, si es que
portable
existe alguna
devices for the
capacitación
elders.
para
Is there
los
some sort
primeros
of
cuidadores
training
de
as
cómo deben
well?
de hacerse el uso de estas herramientas, o si más bien
Specifically,
tienden a
carers
ser
need to start using this
dispositivos que
type
sean
of
más
tools.
autónomos y que no
Well, they
necesiten ningún
usually
tipo de
tend to use
vigilancia,
this type
o
of
no, o que es más bien
devices.
cuidador con
We need to see what's the role of
nuevas tecnologías.
carers whenever
Y la
we
segunda
deal
que
with
le
new
quiero hacer
technologies. And the
la
second
pregunta
one,
a los cuatro
and I wanted
es,
to ask this
no
question
debería
to
no
you.
ser
So
porque
the
en
new
México estamos
government,
por
as you
inaugurar nueva
know,
administración,
in
está
Mexico,
por
we're
poner en
just
marcha
opening
un
this new
proyecto que se
management.
llama Casa
We
por
are
Casa,
about to
que
begin with a
justamente va
project
a
that is
ser esta
called
atención de salud
Household by Household. This
dirigida
is
no solo a personas adultas
healthcare
mayores,
provision,
sino
not
a personas con
only
discapacidad o a personas que
centered on the
no van a
elderly, but
acudir a un
also in
centro
on
de
persons with
salud.
disabilities
En México se
who
está
are not
apostando por la
capable of going
universalización,
to
por
healthcare
sumar los
centers.
sistemas
Now
contributivos
we're
como
just
el ISSSTE
really
contributivo,
trying to get
y se
into
va a
this
desplegar
universal healthcare
un primer
through this contributive
pilotaje
system,
de
so and
enfermeras,
non-contributive. So we will just deploy a
enfermeras
first pilot
médicas
with
para
engineers,
ir puerta por
doctors,
puerta
so that we can just really start knocking on
la
doors
población de México y
for the
descubrir el
population in
estatus de la
Mexico as
salud.
well, so that we can
Entonces nos
discover
preguntaban
the status
si,
of health.
cuál sería su
So we were
recomendación para
wondering what would
incorporar
be the
el uso de
recommendation for us to be able
tecnologías
to incorporate the
en
use of these
este pilotaje que
technologies
va a emprender
in
México
this
en el
pilot
próximo año,
program that
seguramente en
Mexico is going to start
2025. Y
next year. This
también,
is
pues, qué
going to be done
recomendaciones
in
podría
2025. So what are the recommendations
a esta interoperabilidad entre los sistemas
that you could
de
give
salud y
specifically for
social?
the
Y bueno, si tienen
interoperability
alguna experiencia de
between these two types of
empezando por
systems?
esta
And
experiencia,
is there
pues que
any
nos lo compartan
experience of
como lo hizo en su presentación,
countries,
doctor
let's
Pedro. Entonces,
say,
si gusta, le
like
doy honor de
success
la voz para la
stories
primera
that
pregunta.
have really
Empezamos con usted la segunda y ya de nuevo
succeeded
con
in
usted,
this
señorita. Adelante.
in this
No
specific
son
type
pocas
of system?
cuestiones las que plantea, ¿eh?
Well,
Pero
you
yo
are
quería
raising a lot of questions,
comenzar antes que nada
but I just
felicitando
wanted to
a
start
mis
first and
colegas y muy
foremost just
especialmente a la
by really
doctora Katrina,
congratulating my
porque
colleagues,
me ha
specifically
parecido
Dr.
excelente
Katrina. I think
el
that
abordaje que hacen de telemedicina
the way
en Perú.
they
Me ha parecido
are
sencillamente
approaching
espectacular. O sea, que una
telemedicine in
muy
Peru
fuerte
is
enhorabuena.
spectacular. So again,
Respecto
congratulations, doctor.
al uso de los
Now, concerning
dispositivos
the use
portables, los
of
wearables en los cuidados y en
portable
el
or
domicilio,
wearable
son un
devices
elemento
for
complementario. Quiero decir,
care at
son un
home,
elemento que
these
permite,
are
como explicaba también la doctora
well,
Katrina,
they're
tener
very
más
important but
información de lo que sucede
supplementary.
en el domicilio
They're going
mientras
to
no hay un
allow us to provide
personal
that care,
asistencial o de
but it
cuidado
is useless if we do
profesionales
not
en el
have
domicilio.
professional
Por lo tanto, a efectos
healthcarers
del cuidador que acude
in that given home. So
a
what happens
asistir
if
en las
you have a
actividades básicas de la
carer
vida diaria,
providing
tienen que ser un
assistance?
complemento que nos
Well,
permita
this
saber qué
again needs to
pasa
be
y que
a
nos permita
just
tener
somehow
alertas
extra.
tempranas cuando
We
algunos
can
de los
just really
parámetros que
trigger
hemos
some sort of
marcado
early
pues salgan de los estándares que
alerts
nos
or
hemos dado
warnings
respecto
whenever we see
a
some
ese
sort of
indicador,
out of
¿no?
specs
En este sentido,
vitals
las
or
compañías, las startups y las
numbers.
compañías de
So
tecnología que los
startup
están desarrollando,
companies
el
and just
grado de
technology
usabilidad que tienen
companies
es cada vez
are
mayor
really
y muchos
developing
de
all
ellos
of these
son muy
devices that are
similares a los que
becoming
usa
more
el
and more
consumidor
useful. They're very
común.
similar to
En
those
la
that,
muñeca con un reloj
let's say,
inteligente para
someone,
monitorizar
let's
ciertos
say, would
parámetros, ¿eh?
use just to
Entonces,
monitor
en
certain
cualquier
parameters.
caso,
So
el
in any
triángulo que
given
siempre
case,
planteo es
the
cómo
triangle that
insertamos
I'm
esta
just bringing to
tecnología
the
en
table is
procesos
how are we going to
asistenciales,
integrate this
implicando tanto al
technology
cuidador, al
to
paciente y
assistance
al profesional de la salud
aspects
para
as
que
well,
esto
so
se lleve a
for
cabo. Si solo nos
professionals in
quedamos con la
healthcare
tecnología,
aspects. So we
quedaremos
were
cojos
only thinking about
y si
technology,
no ponemos
we would stay,
tecnología, pues
let's say,
estaremos perdiendo toda la
we would
eficacia
fall
que tenemos.
short and
Respecto a
we
la
would not
segunda
really
cuestión del
be able
casa
to
por casa,
provide
pues
everything that is
me
needed. Now,
congratulo
regarding
de
the
su nueva
household by
presidenta, la
household
nueva
program,
presidenta,
I
pues esté
just
abordando
wanted to congratulate you because
enriquecer
now
los
the new
servicios
president is now
asistenciales de
focusing on
salud y sociales en el
enriching
domicilio, porque
these
sin duda esto
healthcare
es la estrategia que
services at
permitirá
home. It
el
is
llevar
without a doubt a
esa
service that is going
atención
to help
más cerca de donde
you
se
really
necesite y las
provide that
personas
care closest
pues
to where you
prefieren estar
need
en su
it.
casa que acudir a un
And people
hospital
just rather
que
stay at
acudir a un
home
servicio
than
de
going
urgencias
to
o
a
de emergencias a ser
hospital
atendidos.
or
Por
going
lo
to an
tanto, todo lo que se pueda hacer
emergency
desde casa,
unit.
bienvenido
So
será, con lo cual
again,
ayudará a
everything that could be
descongestionar los
done at
servicios
home, that's
hospitalarios
great.
y sin
It
duda
is
dará
going
una
to
atención
help
de más
just
calidad al
really
adulto mayor en México y a las personas que
improve the
necesiten esa
traffic
atención.
or the demand of these
Entonces, ejemplos
healthcare
no voy a poner
facilities
más,
on
me
site. I'm not
refiero
going to give you
a los que
further
ha hecho la doctora
examples. I'm just
Catrina, que me
talking
parece que están
about the
mucho más
examples
cercanos
that
que los que
Dr.
pueda
Katrina
aportar
is
yo a lo mejor.
sharing. And I think that that's pretty
Claro
much
que
what
sí,
we could
doctora.
share about
Justamente la doctora tiene
just
el
what we
honor de
have in
comentar.
Europe. So,
Adelante, doctora.
right, the doctor has
Muchas gracias por
raised
las
her hand.
palabras de felicitación,
Thank you
doctor
so
Pedro.
much
La
for
CISS
your,
preciosa, toda la seguridad
well, your
social y
kind
bueno, igual
words.
que cada uno de ustedes, ¿no? Orgullosa de
Again,
estar en un panel con
I can
gente
tell you that
con tanta
we
experiencia
are
y sobre
now
todo muy
sharing a panel.
humana
I'm
para
proud to
poder
be in a
hacer que las
panel
tecnologías
with
lleguen
such
de
experienced
manera, me copio la
panelists.
frase que dijo
And
nuestro
again, I just
amigo
wanted to share
Jordi,
the
¿no?
phrase
La
that
distribución
we
de las
heard from
capacidades.
Jordi.
Ya le sumo
We're
a
just
eso
really
porque la
using
tecnología
in
permite
all
tener
of these
la capacidad
capacities
de que
because we
nosotros
need
vamos
to have
utilizando
this
así como los
equality.
profesionales de
That's
salud
something
para
what they
nuestros
were trying to
alumnos.
do, all of
Una de las
the
primeras
healthcare
preguntas que
professionals. So
preguntas es
one
cómo es que
of the very
nosotros
first thing that you
vemos el tema
mentioned
de la
is how is
educación
it
los
that we're
profesionales de la salud. Quisiera
working with
comentar sobre esto,
education
¿no?
as
Nosotros
healthcare
en Perú
professionals. And I wanted to
tenemos
address this in
aún
Peru, for instance.
las facultades donde se forma el pregrado de los
We
profesionales en
still have
salud
the
muy
authority
distantes
as
a
healthcare
llevar cursos
professional
de salud digital, de
to just
tecnologías,
really give
es decir, estamos
courses
muy
on
lejanos. Solo
technologies
son
and other
dos
topics, but
facultades de medicina en las que
we
están
only
disertando,
have the
una de ellas
schools
son docentes
of
de salud y la otra
medicines
de
of
tecnologías de la
medicine who are just
información.
really
Es
providing this
decir, que tenemos
telemedicine
ahora,
and
y
health
lo quiero
innovation, but
comentar
that's
como
it.
muy
We
joven,
do not
cultura
have it
digital
as
que
a
no sabemos
pervasive
a la
topic
tecnología,
in
¿no? Que
universities.
definitivamente hay
And
que
now we're also
enfocarnos.
talking about
¿Por qué? Porque con referentes a
immunology. We need to
dispositivos de
also
intención
focus our
artificiales,
efforts on
la
this
gestión de los
digital
datos,
skills and data
específicamente igual la
management,
regulación,
specifically on
todos
ethics
estos
and
puntos. Entonces,
regulations and all of
centrar
these
no
topics
solamente en lo
that are
nuevo
key,
que tiene
not
la
just
tecnología
what's new regarding, let's say, technology as such, but just really everything that we can share. It is really important. We're also trying to do all of this from the National Telehealth or Telemedicine Center. We're just really trying to improve all of the subjects given at a graduate and postgraduate levels so that we can just really keep on educating our healthcare professionals And now, regarding this initiative that we will have in Mexico, household by household, we understand that this is to provide more tailor-made type of healthcare, and we may have some sort of recommendations. The very first thing is to just start collecting all of the data of the population that you are seeking to intervene. It does not really have to do with the age group. Our colleagues were discussing this as well. It has to do with ideas, mindset, cultural relevance, characteristics of their own, let's say, all of this, and with all of the different determinant factors, just to decide whether a population needs intervention or not, and then to just really start just tracing the journey of a patient, how it starts and how it ends, and now training healthcare professionals that are going to intervene. Again, the household program. This is going to be also conducted by nursery students. And more importantly, as the first step, we need to just really generate this care leadership. This could be a source with certain characteristics that could help us favor this interesting intervention, and that we congratulate as well on behalf of the team here. Thank you so much, Doctor. I'm positive that we could just somehow create some sort of a bridge between Mexico and Senate, and well, specifically for this project that it's just in its kickoff phase. So, Doctor, I see that you have raised your hand. Yes. First, I just wanted to congratulate you for addressing these new strategies in Mexico, in Bolivia, since 2012, 13. We started with the household by household program. We call it National Health Subsidies Health Program. This is a program that, according to our family health program for the community, and with a component of interculturality, we know that patients in that case do not need to be professionals in general in terms of medicine. We need to include the cultural component, because one of the main barriers that we've seen is language. In this case, for instance, we have, again, in the Andean region, we have Quechua, we also have Guarani, and we have over 30 indigenous languages, and we are also a diverse country. So this strategy, I feel that it is very good as well. So this started 12, 11 years ago, when we started just implementing this policy to improve access to healthcare with justice and equality. So, like Dr. Corina mentioned, they need to be trained so that they can just follow this route. Let's say a patient or a physician who is part of this household by household program, they identify that the patient suffers from some sort of heart disease, then they would just apply this telemedicine all over the country. We have over 170 hospitals that are interconnected to healthcare centers where the just general doctor could just have the assistance of a specialist, let's say a cardiologist, pneumologist, or imaginologist, depending on their experience versus working in a rural area. So they also have experience. So this is something that has been just streamed to a second or third level hospital, and it has already been assessed by an imaginologist and then by an expert in the field, like a, let's say, clinical doctor, a neurologist, or I mean, just you name it. And now, regarding this, we need to accept that there's no integration yet between the graduate and postgraduate degree. We know that specifically in their curriculum, they're not including this component, but again, we're going to be giving students the theory of digital health. However, we still need to see that integration or the medicine technology so that we can really start just seeing this in practice with, let's say, medical care. So I think that this is necessary. We do need to have this interaction of universities and the social security system, the public system in general, so that they can have both in graduate and postgraduate studies and all of this. So another thing is that now with this strategy, let's say with physicians, let's say they can also learn from the population itself. Why? Because a physician may read many books, but it is easier to ask the population, what are your beliefs? What are your thoughts? And that way they could just somehow, let's say, if they have their customs and traditions based on their culture, they just need to really see if they can somehow be adjusted to the new technologies in their experience, specifically in the northern part of the country. We, for instance, work in the northern part of La Paz city. There are some persons who do not speak Spanish at all, so we need one or two interpreters for us to be able to communicate with our healthcare professionals, and we have managed to have that interaction. So now the patient, without really requiring, let's say, a capital city, they do not need to travel, let's say, 24, 30 hours in a canoe or in a boat or whatever for them to reach the city. So they have had that type of care with an expert physician. We have a lot of cases, specifically in pediatrics and with newborns as well. Thank you so much, Dr. Edward. So before we move on, I just wanted to thank Dr. Jordi. I know that he has to leave. And considering that, of course, there's a time zone difference, we just wanted to thank you so much for being here. I know that he has to leave. We appreciate, I know that your microphone is off, but it was such an honor. Thank you so much. It was amazing. Thank you. Congratulations. See you soon. And going back to you, Dr. Irving, so just very quickly, we were asked, how was this process of acceptance? You were talking about this image you were just showing when you were having this visit with a chatbot. So why don't you share what are, let's say, the challenges whenever we see these how the population is really embracing this type of services. So now the question that was raised is, what are you doing to just somehow foster more investment in technology from our country? So in case you just want to answer, you can just answer yourself and we can ask other panel members to do this. Right. So first and foremost, we need to recognize that every time we have a new technology, a new tool implemented or deployed, we of course fear changes. We have reluctance because we fear changes. But as we start just learning more about a given tool and more persons start just really knowing more about this, let's say patients, healthcare professionals, then they start just seeing and recognizing the benefits of these tools, of these new technologies as well. And today, and in 2014, on October the 1st, 2014, that's when we saw that this national health program was, well, just kicked off. It started with tele education or remote education, and this is how we just apply this monitoring. So little by little, our patients started to have access based on how easy it was for them to have access to these healthcare models just by using it. And also with in our country we had a high demand of just specialist visits. So the national healthcare program allowed patients to have access to second, third, and fourth level specialties for them to address their health conditions. So what is needed to drive this implementation of or again embracement of all of this? We just need political will. Why? Because maybe a couple of decades ago we needed a higher financial investment, but nowadays we have even a lower financial investment than we can create or establish the technological infrastructure needed for this. And then just through cooperation, of let's say neighbor countries, as in our case with Peru, Argentina, and also with Spain. And we have managed to share not only information but also scientific studies, and we have managed to share a little with this infrastructure. So we need training from a pre-graduate in a pre-graduate program or curriculum, and we need to prove what are the benefits of these technologies. And it is very important as well for us to just foster or promote this political will. Thank you so much, Doctor. So, Dr. Bernadette, I know that one of our participants is asking us to share your email with him or her. Just we wanted to ask you if that's possible. Please just let us know. And now, just to wrap it up, the structure of healthcare infrastructure, let's say telemedicine or digital care. Well, the questions that we had and we compiled it is what are the perspectives? What is the forecast specifically for the future plans that we have, specifically to treat diseases such as dengue, and how is digital health going to address this? Thank you for your questions. I would like to step back and just go back in time and just to give a comment on what Dr. Edwin mentioned very interestingly. And I wanted to summarize because we need to think about the experience that we have ourselves. So we, in 2014, 2013, for the very first time on February the 19th, we just took an MRI. We saw a lot of medical imaging in different regions. We were treating a patient. He had a brain uh, stroke. So this was a high-end MRI and CAT scan. And well, we're working with Social Security, and probably the most important component for us to be able to complete that cycle was a radiologist, but he only spent time 15 days in the region, and then we needed another, well, expert, you know, doctors. We had systems, but again, we were not completing the full cycle because we did not have the experts in place. And that's how we started to work with this virtual visit. So again, we started generating changes in the institution for us to be able to go back to certain characteristics. We know that there are some topics that are extremely important. We needed to identify who are those professionals who are just really helping us just really manage this change and to do all of this in a cross-disciplinary manner. Again, if there is no technical support that can actually show us that we could get to good results, then it is very likely that even though we have political will, this is not going to come to completion. So again, graduate physicians are not going to get to that point. So we need to start mapping the different cultural characteristics that we may find in a given population, and just really compiling and collecting all of the information that is needed based on their needs. One of the characteristics is digital health and, let's say, immunology that could also be more sustainable over time. Now, concerning the question raised regarding how are we intervening in the dengue epidemics. In our case, our intervention was with telemonitoring. So we were catering the service to the Peruvian population as well. And also we also have as well in the country, and there were some others in the southern part as well. And so I know that this is something that was really, really important, not only how to do all of this. So what did we do in this regard? We started to have some interventions with technology. We included a pool of nurses. They were just working in nursing, and we were just really trying to really address dengue in the country. So we were just really following up on all of this in 48 hours. We worked with patients just by using our this video conference systems, and if we found some sort of sign or symptom, then we would just really generate these alerts so that, well, in the end, we could go to the EPRES, which was the healthcare facility, and then the quality department of Social Security had its own chatbot, and this was for the population to start to seeing all of the different questions. So what we noticed is that we had dengue, and that's the e-learning platform that we have, and that we started to have all of this information. So like I mentioned in our presentation, well, it's been 2 years since we did this intervention, so we were having this, let's say, mortality, and it dropped quite significantly.
Perfecto, doctora. No, pues no nos
Perfect,
queda
thank
más
you.
que agradecerles por
So
tan rico panel,
I
tan
just have to thank you for such a
experiencias
great
muy,
panel
muy
in
interesantes que nos detonan
very
nuevas
interesting
conversaciones.
experiences
Pues
that
espero
are
que no
just
sea la
leading us
última
to
vez que
new
tengamos la oportunidad de
conversations.
escucharles, de
Hopefully, this
colaborar
is
con
not the
ustedes.
last time that we're
Ha sido un
collaborating with
panel
you.
muy rico. Yo les
This has
agradezco
been quite a
muchísimo una vez
very
más haber aceptado nuestra
enriching
invitación.
panel.
También agradezco a
Once
todo
more,
nuestro
thank you so
cuadro de
much for
agradecimiento
taking
a
our
todo el panel.
invite as
Pues a
well.
todo nuestro auditorio yo
And
les
again,
invito
we
a
just
mañana
want to thank
sintonizar el último
our
diálogo de alto nivel, donde
public or
estaremos hablando
participants
sobre
to
el uso
join
de la
us
inteligencia
tomorrow. We
artificial
will talk
en
about the
los
use of
sistemas de seguridad
AI
social, un tema que
on
estamos
social
un
security
poco vinculado
systems.
con lo que vimos el
This
día
is
de hoy.
somehow
Entonces,
related to the
pues
topic
no me queda
that
más que
we addressed
agradecerles una
today.
vez más
So
a nombre de la
there's
CISS.
nothing left for me to do but to
Esperamos que
thank you
mañana
as
nos
well.
podamos sintonizar y que tengan una
And
excelente
just for
tarde.
us to be able
Muchísimas
to
gracias.
address all of this, so let's
Gracias,
have
Pedro. Gracias,
a
doctora.
lovely
Gracias, doctora
evening, all of
Paula.
us. Thank you so
Rico
much,
tu medio.
doctors.
Muchas
I hope
gracias.
you have a great day. Thank you so much.